increase the pace over here as well. So please remember, if about the femoral sheath, if I talk about, as I told you, it is a tendon sheath which covers the upper surface of the vessels, okay, and therefore it forms a canal-like pattern, okay, and therefore you can see it would be divided into three compartments. The lateral is the arterial compartment, the intermediate is the venous compartment, and the medial one is the nodal compartment, that is for the lymph nodes. Okay, so the mnemonic from lateral to medial is AVN. From lateral to medial, it is AVN, right? So lateral compartment may there would be femoral artery along with femoral branch of the genitofemoral nerve. Then in intermediate compartment, there would be femoral vein, and in the medial compartment, there would be femoral canal. Okay, the medial compartment of femoral sheath is called as femoral. The medial compartment of femoral sheath is called as femoral, and this femoral canal contains lymph nodes of Cloquet or lymph nodes of Rosenmuller. Important ये question आ चुका है, ठीक है? So lymph nodes of Cloquet or lymph nodes of Rosenmuller are present in the femoral canal. They are present in the femoral canal. कोई दिक्कत नहीं है इसमें. Next, moving forward, I was talking about brachial plexus. ठीक है? So brachial plexus is formed from which nerve roots? C5 till T1, C5 till T1, C5, C6, C7, C8, and T1 nerve root. ठीक है? C5 and C6 forms the which trunk? Upper trunk. C5, C6 forms the upper trunk. C7 forms the middle trunk, and C8 and T1 together forms the lower trunk. So how many trunks? 3 trunks: upper, middle, and lower trunks. These lower trunks will divide into divisions. That is anterior and posterior division. Anterior and posterior divisions, right? So these trunks divides into anterior and posterior division. Important, they will ask you the trunks and the divisions will lie in which triangle of the neck. If they ask you the trunk and the triangle will lie in which triangle of the neck, answer is usko kya bolte subclavian triangle. Okay, the trunks and nerves will lie in the trunks and divisions will lie in the subclavian triangle. No issues with this. After divisions, now these divisions will combine with each other and they will lead to formation of cords. Okay, so cords banenge uske baad. Okay, cords would be present in the axilla. Cords are present usually in the axilla. Okay, beneath the clavicle hota hai, and then usually the branches are present from the axilla onwards. Okay, no issues with this. So we have lateral, posterior, and the medial cord. Lateral cord is formed from anterior divisions of upper trunk and middle trunk. Lateral cord is formed from anterior divisions of upper trunk and middle trunk. The posterior cord is formed from all the 3 posterior divisions. Posterior cord is formed from all the 3 posterior divisions, whereas medial cord is formed from anterior division of the lower trunk. Okay, medial cord is only formed from one division, that is the anterior division of the lower trunk. Next is mnemonic. As we know, lateral cord ka mnemonic is, the branches mnemonic for lateral cord is LML. It is LML. L for lateral pectoral nerve. L for lateral pectoral nerve. M for musculocutaneous nerve. M for musculocutaneous nerve. And as we know, what is the root value of musculocutaneous nerve? C5, C6, C7. Okay, C5, C6, C7 is the root value for musculocutaneous nerve. And as we know, musculocutaneous nerve is known to innervate the anterior compartment of the arm. It is known to innervate the anterior compartment of the arm. So the flexor muscle of the anterior compartments of arm, okay, they are innervated by the musculocutaneous nerve. They can ask you exception. Kaise? All the muscles of anterior compartment of arm are innervated by musculocutaneous except. So the mnemonic is BBC. Mnemonic is BBC. That is brachialis muscle, biceps brachii muscle, and coracobrachialis muscle. Which 3 muscles are innervated by musculocutaneous? BBC. B for brachialis muscle, second B for biceps brachii muscle, and C for coracobrachialis muscle. But which is not innervated? Brachioradialis. Okay, which is not innervated by musculocutaneous? Brachioradialis muscle is not innervated by the musculocutaneous nerve. No issues with this. Musculocutaneous also gives 2 cutaneous nerves. Okay, musculocutaneous gives 2 cutaneous branches. First is the lateral cutaneous nerve of arm. Second is the lateral cutaneous nerve of forearm. Okay, lateral cutaneous nerve of arm and forearm are branches of musculocutaneous nerve. And last L goes for the lateral branch of the median nerve. Last L goes for the lateral branch of the median nerve. Then if I talk about the medial cord ka mnemonic is M4U. M4U. First M goes for the medial pectoral nerve. Second M goes for the medial root of the median nerve. Second M goes for the medial root of the median nerve. Okay. Next, usually the third M goes for the medial cutaneous nerve and the of arm and medial cutaneous nerve of forearm. As I told you, lateral cutaneous nerve of arm and lateral cutaneous nerve of forearm are branches of musculocutaneous nerve. But medial cutaneous nerve of arm and medial cutaneous nerve of arm, they arise from the medial cord. They arise from the medial cord. कोई दिक्कत नहीं है. Lateral musculocutaneous and medial, usually the medial cord. And U lastly goes for the ulnar nerve. So largest branch of the medial cord is the ulnar nerve. What is the root value of ulnar nerve? C7, C8, T1. C7, C8, T1. Whereas if I talk about the posterior cord now, the mnemonic for posterior cord to be remembered is lunar. The mnemonic is lunar. L goes for the lower subscapular nerve. L goes for the lower subscapular nerve. Then U goes for the upper subscapular nerve. U goes for the upper subscapular nerve. Lower and upper subscapular nerve will innervate which muscle? Naam sahi hai. Subscapularis muscle. They will innervate the subscapularis muscle. Important thing is lower subscapular nerve will also innervate one more muscle, and that is important. Teres major. Okay, lower subscapular nerve also innervates one more muscle that is known as teres major. Lower subscapular also innervates one more muscle called as teres major. Okay. Then N goes for the nerve to latissimus dorsi. N goes for the nerve to latissimus dorsi, and the nerve to latissimus dorsi is also called as thoracodorsal nerve. Nerve to latissimus dorsi is also called as thoracodorsal nerve. As we know, latissimus dorsi is also called as which muscle? Anybody? Latissimus dorsi is also called as which muscle? Anybody? Very good. It is called as the climber's muscle. Latissimus dorsi is a back muscle known as climber's muscle. No issues with this. And lastly, A goes for the axillary nerve. A goes for the axillary nerve, and R goes for the radial nerve. The terminal branch or the largest branch of the posterior cord is radial nerve. The largest and the terminal branch of posterior cord is radial nerve. Important. Okay? And as we know, median nerve is formed from two roots. Lateral cord से कौन सा आता है? Lateral root of median nerve. Medial cord से कौन सा आता है? Medial root of median nerve. And then the median nerve is formed. ठीक है? What is the root value of radial nerve and median nerve? दोनों का same है. The root value of median nerve and the radial nerve is C5 till C1, C5 till T1, C5, C6, C7, C8 and T1. The same as the brachial plexus. पूरा का पूरा होता है in median and the radial nerve. No issues with this. What is the root value of axillary nerve? This is important. They have asked it. C5, C6. Root value of axillary is C5, C6. Root value of axillary is C5, C6. And the axillary nerve wounds around the neck of the humerus. Which neck? Anatomical or the surgical neck? So it wounds around the surgical neck of the humerus, and therefore it is also called as the surgeon's neck. It is also called as the surgeon's neck. No issues with the surgeon's nerve. Okay? No issues with this. Musician's nerve is another name for ulnar nerve. Musician's nerve is the ulnar nerve because it will innervate which muscles? Intrinsic muscles of the hand. Ulnar nerve innervates the intrinsic muscles of the hand mainly, and therefore it is responsible for fine movements, and therefore it is called as the musician's nerve. If I talk about the median nerve, is also called as the laborer's nerve. Median nerve is also called as the laborer's nerve because it will mainly innervate the flexor compartment of the forearm. Median nerve mainly innervates the flexor compartment of the forearm. So all the flexor muscles which you require for lifting heavy weights, वगैरह, okay, that is innervated by the median nerve. Therefore, it is also called as the laborer's nerve. कोई दिक्कत नहीं है. Important. ठीक है. इतना याद रख लो. So important is from the upper trunk we have some branches that arise. Okay, they are not from the cords. They arise directly from the upper trunk. This is the dorsal scapular nerve. Dorsal scapular nerve will innervate which muscles? Anybody? Dorsal scapular nerve innervates which muscle? It innervates rhomboidus major. It innervates rhomboidus, also rhomboidus minor, and also levator scapulae. So three muscles innervated by the dorsal scapular nerve are: first is rhomboidus major, second is rhomboidus minor, and third is the levator scapulae muscle. No issues with this. Trapezius and sternocleidomastoid were innervated by? Very good. They were innervated by the spinal accessory nerve. That is the 11th cranial nerve. Okay, important. Then also suprascapular nerve arises from the upper trunk, and this suprascapular nerve will innervate the supraspinatus muscle as well as the infraspinatus muscle. Okay, supraspinatus in the supra and infraspinatus are usually on the posterior or the dorsal aspect of the स्कैपुला, वहां पे फोसा होते हैं. सुप्रास्पाइनेटस से सुप्रास्पाइनेटस मसल आएगी, इंफ्रास्पाइनेटस से इंफ्रास्पाइनेटस मसल आएगी. नो इश्यूज विद दिस एनीबॉडी? याद रख लो. And the subclavius nerve also arises from the upper trunk. This subclavius muscle, by the name it is evident, it will innervate the subclavius muscle. Important thing to be remembered is all of these, that is the sits muscle, these are called as the sits muscle are called as the rotator cuff muscle. The sits muscle are called as the rotator cuff muscle. So rotator cuff muscles कौन से होंगे? Sits. First S goes for the supraspinatus. First S goes for the supraspinatus. I goes for the infraspinatus. I goes for the infraspinatus. T goes for teres major or teres minor? T goes for the teres minor. T goes for the teres minor. And S goes for the subscapularis. S goes for the subscapularis. Which is the forgotten muscle in the rotator cuff? Subscapularis. The forgotten muscle of the rotator cuff is subscapularis. And if there is adhesive inflammation, okay, adhesive inflammation of this rotator cuff muscles, that will cause which condition in the patient? Very good, it causes the frozen shoulder. Okay, if there is adhesive inflammation of the rotator cuff muscles, it causes the adhesive inflammation of the rotator cuff muscles causes the frozen shoulder. Important, जो ortho से recall आया था, question important है. A patient was not able to abduct his arm. Okay, so a patient was not able to abduct his arm usually after certain distance. That means after 15 degrees. Okay, or after 90 degrees. So this is due to this condition is called as anybody? When the patient is not able to abduct the arm from 60 degrees to 120 degrees. Patient is unable to abduct the arm, from 60 degree to 120 degree. हमने ऑर्थो में डिस्कस किया था. It is called as the painful arc syndrome. It is known as the painful arc syndrome. So when painful arc syndrome होता है patient में, there is inflammation of the tendons. Okay, there is inflammation of the tendons, and therefore the patient is unable to abduct the arm from how many degrees to how many degrees? 60 to 120. 60 to 120 degree. The patient is unable to abduct the arm. कोई दिक्कत नहीं है इसमें. That is what is the painful arc syndrome, and it is due to inflammation of the anybody? It is due to inflammation of the supraspinatus. It is due to inflammation of the supraspinatus. ठीक है, तो you will ask कि sir overhead abduction या ये 60 to 120, तो ये तो नहीं होता supraspinatus से, but it is not due to the function. Okay, it is the inflammation. So when this inflamed tendon of the supraspinatus, supratendonitis बोलते हैं उसको, ठीक है. So when this inflamed tendon of supratendon passes beneath the acromion process, then the patient will experience pain. Okay, before that and after it escapes, the patient will not experience pain. That is what is called as the supraspinatus tendonitis, also called as the painful arc syndrome, when the abduction would be difficult between 60 to 120 degree. Jaldi se batao, abduction of arm 0 to 15 degrees is the responsibility of 0 to 15 degree. Supraspinatus 0 to 15 degree. Supraspinatus 0 to 15 degree. Supraspinatus 15 to 90 degree deltoid. 15 to 90 degree deltoid. Above 90 degree overhead abduction, trapezius and serratus anterior. Trapezius and serratus anterior. Overhead abduction और above 90 degree. कोई दिक्कत नहीं है इसमें, तो ये important syndrome याद रख लेना. ठीक है. If I talk about the innervation, cutaneous innervation of the hand, that means skin को कौन innervate करता है, कौन सी nerves, okay, of the hand. So it is important. So rotator cuff, it is usually due to frozen shoulder. ठीक है. Frozen shoulder means no movement of the shoulder would be possible. No movement. Okay. Neither flexion, neither abduction, neither adduction. Nothing would be possible in cases of frozen shoulder. Patient would just hold the hand like this. ठीक है. So no movement is possible. With painful arc, the patient can perform the other functions easily. But when the patient tries to perform abduction from 60 to 180 degree, then there would be pain. That is what is called as painful arc syndrome or supraspinatus tendonitis. ठीक है, तो कोई दिक्कत नहीं है. If I talk about the cutaneous nerve of the cutaneous innervation of the hand, so I hope all of you are quite aware. The lateral 1/3 of the fingers, okay, the lateral 1/3 of the lateral 3.5 fingers are innervated by the median nerve, okay, on the ventral side, and on the dorsal side the lateral 3.5 fingers are innervated by the radial nerve. On dorsal aspect, the lateral 3.5 fingers are innervated by the radial nerve, whereas medial 1.5 fingers on dorsal as well as ventral aspect, both they are innervated by the ulnar nerve. So medial 1.5 fingers on both aspects are innervated by the ulnar nerve. But important, dorsally the tips, okay, dorsally the distal phalanx, the skin over the distal phalanx is innervated by the median nerve. Dorsally the skin over the distal phalanx of lateral 3.5 fingers is innervated by the median nerve. कोई दिक्कत नहीं है इसमें, important. ठीक है. As we discussed, injury to the upper trunk of the brachial plexus will lead to Erb's palsy. It will cause Erb's palsy in the patient. The nerve roots injured would be C5 and C6. Okay, it will lead to which deformity? Adduction, internal rotation, and flexion at the wrist. This is called as which deformity? Policeman tip deformity or the waiter's tip deformity. Okay, important. Along with that, important तुम जो पूछ रहे थे वो यहाँ बता रहा हूँ मैं, ठीक है? So Horner's syndrome क्यों होगा in patient of Erb's palsy? It is not when the nerve is injured. It is when the cervical sympathetic chain is also damaged. ठीक है? Both of these structures, because the upper trunk and the cervical sympathetic chain, they lie in close relation. They lie in close relation. So if any tumor like a pancreas, if it is damaging the Erb's, if it is damaging the upper trunk, it will also damage the cervical sympathetic chain. And if it damages both, then the patient can have a Horner's syndrome along with Erb's palsy. Okay, and Horner's syndrome, as we know, it is remembered by the mnemonic perfect meal. Jaldi se. P for ptosis, P for partial ptosis, M for meiosis, M for meiosis, E for enophthalmos, E for enophthalmos, A for anhydrosis, A for anhydrosis, and L for loss of ciliospinal reflex, L for loss of ciliospinal reflex. कोई दिक्कत नहीं है. Whereas if there is injury to the lower trunk of the brachial plexus, that will cause the Klumpke's palsy. And Klumpke's palsy will cause which type of hand? Partial claw hand. Klumpke's palsy will cause partial claw hand. Lower trunk. What is the root value which is injured? C8T1. Okay, then root value which is injured is C8T1. कोई दिक्कत नहीं है. Shoulder dystocia में the patient can have Klumpke's or Erb's palsy more commonly. So usually for shoulder dystocia, when it obstructs, okay, so it can be over the this one, over the upper trunk. Okay, so that Erb's palsy is more common. Klumpke's palsy, if it occurs, it is more severe. Okay, more severe. No issues with this. याद रखना. If there is, there is long thoracic, if there is long thoracic nerve injury, also known as nerve of Bell. So long thoracic nerve is also known as nerve of Bell, and it supplies which muscle? It innervates the serratus anterior muscle. It innervates the serratus anterior muscle. If there is palsy of the long thoracic nerve or the nerve of Bell, it will cause winging of scapula. It will cause winging of scapula. एक और चीजें हम देखते हो आगे जल्दी से. अगर deformities बतानी है तुम्हें, ठीक है? If there is a median nerve injury, it will cause which deformities? First, the patient tries to close the hand but is not able to close. This will lead to a benediction hand. This will lead to a benediction hand, also known as the Pope's hand. Also known as the Pope's hand. It is due to injury to the median nerve. It is due to injury to the median nerve. And if the thumb comes to lie in the adduction position, this is known as the ape's thumb deformity. If the thumb lies in adduction, it is known as the ape's thumb deformity. It is due to injury to the median nerve again. Ape's thumb deformity is due to injury to the median nerve. Okay, unopposed action of adductor pollicis would be there, and this adductor pollicis is innervated by the ulnar nerve. Adductor pollicis by the ulnar nerve. All other thenar muscles by the median nerve. कोई दिक्कत नहीं है इसमें. 9. Obstetrician's hand is due to hypocalcemia, which is also called as the Trozios sign or the carpopedal spasm. That is a different. दिखता है, but it is usually on inflating the BP cuff. तब जाके patient में होगा, not directly. ठीक है? हाँ? बता रहा हूँ. एक सेकंड मुझे एक complete करने दो. Then if I talk about the claw hand, ठीक है? So partial claw hand, as we know, it is due to injury to which nerve? Ulnar nerve. Whereas complete claw hand is due to injury to the both ulnar plus median nerve. Wrist drop is due to injury to the dorsiflexion of the wrist is not possible. That means the wrist drop is there. This is due to injury to the radial nerve. And if a patient alcoholic was drunk on a Saturday night and then rest usually on the armchair, okay, and then rest usually on the armchair, then there can be compression of the lower. There can be compression of the lower trunk. There can be compression of the lower trunk, and that will cause injury to the radial nerve. That will cause injury to the radial nerve. So armchair पे अगर injury होती है due to compression, it will compress which nerve? Radial nerve. So this is also called as crutch palsy. This is also called as crutch palsy. That means polio crutches जब होता है, again compression to the lower trunk would be there. So this is also called as crutch palsy, also known as Saturday night palsy, also known as Saturday night palsy, also known as honeymoon palsy, also known as honeymoon palsy. So jaldi say, the palsies of radial nerve are called as, first is the crutch palsy, first is the crutch palsy, second is the Saturday night palsy, second is the Saturday night palsy, and third is the honeymoon palsy. All are injuries to the radial nerve, and it will lead to a wrist drop. Which ये बता दो अभी, which splint is used for radial nerve injuries? Dynamic cock-up splint. Which splint is used? Dynamic cock-up splint. Okay, important. For ulnar nerve injuries, we use a knuckle bender splint. For ulnar nerve, we use the knuckle bender splint. Important चीजें हैं. Deep branch of the median nerve is called as. Deep branch of the median nerve is called as AIN. Anterior introitious nerve. Okay, deep branch of median nerve is called as AIN, anterior introitious nerve. Whereas deep branch of radial nerve is called as PIN. Deep branch of the radial nerve is called as PIN. That is posterior introitious nerve. Okay, deep branch of radial is called as the PIN. Posterior introitious nerve. Okay, they will innervate the deep compartments of the forearm anteriorly and posteriorly respectively. No issues with this, anybody? Yaad rakhna, theek hai? Then if I talk about this one, Fromen's test, as I told you, sabko test pata ya nahi pata? So this is the book or the card which is given. Okay, if the patient holds the card normally like this, okay, if the patient holds the card normally like this, then the patient is normal. But if the patient could not do adduction of the thumb, the patient could not do adduction of the thumb and rather do the flexion of the thumb, and holds it, then definitely the adductor pollicis is paralyzed. The adductor pollicis is paralyzed, and adductor pollicis is injured by the ulnar nerve. So Fromen's test would be positive in ulnar nerve injury. Fromen's test or Fromen's sign is positive in ulnar nerve injury. Phalen's test is positive in median nerve injury. Phalen's test is performed for the median nerve injury. As I told you, reverse Phalen's test or Namaste is performed for diabetic cheroarthropathy. A gap would be left. Diabetic cheroarthropathy. Reverse Phalen's test. Okay, important. Pointing index sign. If you ask a patient to close the fist, but he is not able to close the fist, the only index is pointing. This is known as the pointing index sign. It is due to which nerve injury? Median nerve injury. And Igawa test. Okay, so Igawa test, when you ask the patient to raise a finger and move it sideways, it is due to which injury? Ulnar nerve injury. Okay, ulnar nerve injury. What is paralyzed in which muscle? Very good. It is the palmar or the dorsal interossei. When the patient is unable to move the finger sideways, which muscles are paralyzed? Palmar or the palmar or the dorsal interossei. Palmar or the dorsal interossei. Important. Mnemonic क्या है? Palmar interossei responsible for which function? Pad. Palmar interossei causes adduction. Palmar interossei causes adduction. Palmar interossei causes adduction. Pad. And dab. Dab means dorsal interossei causes abduction. Dorsal interossei causes abduction. Dorsal interossei causes abduction. कोई दिक्कत नहीं है इसमें. And all the interossei, palmar 4 interossei and dorsal 4 interossei are innervated by the ulnar nerve. Lumbricals की अगर मैं बात करूँ, lumbricals help in flexion. Okay, lumbricals help in flexion of the fingers. So first and second lumbricals are innervated by the median nerve, whereas third and fourth lumbricals by the ulnar nerve. So third and fourth lumbricals by the ulnar nerve. Okay. Majority of the intrinsic muscles of hand are innervated by the ulnar nerve. Majority of the flexor compartment muscles of forearm are innervated by the median nerve. Okay, कोई दिक्कत नहीं है. The muscle which receives dual nerve supply are called as hybrid muscle or composite muscle. The muscles which receive dual nerve supply are called as hybrid muscle or composite muscle. One such muscle in forearm is flexor digitorum profundus. Flexor digitorum profundus. The medial half of flexor digitorum profundus is innervated by the ulnar nerve. Medial half by the ulnar nerve. Medial half by the ulnar nerve. Whereas lateral half by the median nerve. Lateral half by the median nerve. कोई दिक्कत नहीं है इसमें, सब important चीजें हो गई है. ठीक है. I'll discuss it further. Anatomical nerve box एक बार जल्दी से रिवाइज करते हैं. Lateral. So this one. So this depression that you can see over here. ठीक है. This दिख गया. This depression that you can see over here, which is formed, okay, on the lateral aspect of the wrist. This is what is your anatomical snuff box. This is what is the anatomical snuff box. ठीक है. The floor of this anatomical snuff box is formed by two bones, scaphoid and trapezium. Floor of anatomical snuff box is formed by two bones, that is scaphoid and trapezium. The lateral border is formed by two muscles, Lateral border is formed by two muscles, that is abductor pollicis longus, abductor pollicis longus, and extensor pollicis brevis, extensor pollicis brevis. Okay, whereas medial border is formed by one muscle, that is extensor pollicis longus, medial border by extensor pollicis longus. Okay, no issues with this, anybody? ठीक है, याद रखना. Then content of the anatomical snuff box is the radial artery. Content of anatomical snuff box is the radial artery, and anatomical snuff box will be damaged due to fracture of the scaphoid. There are all carpal bones. jaldi se carpal bones. The first carpal bone to appear is, usually carpal bones are not present at birth. The first carpal bone usually appears around 3 to 4 months after birth. And the first carpal bone to appear, anybody online? Very good. The first carpal bone to appear is capitate. First carpal bone to appear is, it appears at around 3 to 4 months after birth. It appears at around 3 to 4 months after birth. The second carpal to appear is hamate. Second carpal to appear is hamate. Second carpal to appear is hamate. The last carpal to appear is pisiform. The last carpal to appear is pisiform. And as we know, pisiform is a sesamoid bone. Pisiform is a sesamoid bone. So sesamoid bones are the bones which will ossify in the tendon of a muscle. Sesamoid bones are the ones which will ossify in the tendon of a muscle. Pisiform ossifies in which tendon, anybody? Flexor carpi ulnaris. Pisiform ossifies in the flexor carpi ulnaris tendon. Pisiform ossifies in the flexor carpi ulnaris tendon. Pisiform ossifies in the flexor carpi ulnaris tendon. याद रखना, ठीक है? And pisiform is formed around or ossified around. Pisiform appears at around 10 to 12 years of age. Okay, pisiform appears around 10 to 12 years of age. कोई दिक्कत नहीं है इसमें. Carpal bones important है. Boat-shaped carpal bone is the boat-shaped carpal bone. Scaphoid. Boat-shaped carpal bone is scaphoid. Half-moon-shaped or concentric shaped is lunate. Half-moon-shaped or concentric shape is. If they ask you the most common carpal bone to fracture, the most common carpal bone to fracture is, most common carpal bone to dislocate is, most common carpal bone to dislocate is lunate. Most common carpal bone to dislocate is lunate. And if there is a lunate dislocation of subluxation, the patient can have carpal tunnel syndrome. The patient can develop carpal tunnel syndrome. कोई दिक्कत नहीं है इसमें, याद रखना important. Okay. And scaphoid is the second most common site for avascular necrosis. Scaphoid bone is the most common site, second most common site for AVN, avascular necrosis. So it is due to fracture at which part of the scaphoid? The most common site. Very good. Most common site of scaphoid fracture is the waist of scaphoid. Most common site of scaphoid fracture is the waist of scaphoid. And therefore, which blood supply would be cut? Distal or proximal? Proximal part of scaphoid, the distal, the blood supply would be cut off, and therefore, usually the proximal AVN is more common in scaphoid. Proximal AVN is more common in scaphoid. Most common site for avascular necrosis, head of femur. Most common site for avascular necrosis is head of femur, and the fracture associated is the fracture neck of femur. Third most common is the talus. Third most common site is the talus. Third most common site is the talus. ठीक है? Talus में, sorry, talus में क्या होता है? Body of talus. Okay, there is fracture at the neck of talus. Fracture at the neck of talus. Fracture at the neck of talus, which causes AVN of the body of talus. Which causes AVN of the body of talus. कोई दिक्कत नहीं है. Then talus में हमने बोला था posterior tubercle होता है, also known as os trigonum. This os trigonum is which type of epiphysis? Anybody? Very good. It develops as a separate bone, so it is known as a atavestic epiphysis. दो type के atavestic epiphysis we discussed. Posterior tubercle of talus, and second is the coracoid process of scapula. कोई दिक्कत नहीं है इसमें. Moving further. Now talking about this one. Here you can see, okay, a tendon sheath which usually extends, okay, from the medial to the lateral side. This is known as the flexor retinaculum. This is known as the flexor retinaculum. And beneath the flexor retinaculum, the space which is present, it is known as the space between the flexor retinaculum. Nice. Very good. It is known as the carpal tunnel. Okay, the flexor, the space beneath the flexor retinaculum is known as the carpal tunnel. The space above the flexor retinaculum is actually called as the ulnar canal or the Guyon's canal. Ulnar canal or the Guyon's canal. So याद रखना, beneath flexor retinaculum, carpal tunnel. Beneath flexor retinaculum, Beneath flexor retinaculum, above flexor retinaculum, Guyon's canal. Above flexor retinaculum, Guyon's canal. कोई दिक्कत नहीं है. And Guyon's canal is usually formed. Base is formed by the flexor retinaculum, whereas roof is formed by the pisohamate ligament. Roof is formed by the pisohamate ligament. Roof is formed by the pisohamate ligament. In between the space is called as the Guyon's canal, also known as the ulnar canal, because which nerve passes via Guyon's canal? Which nerve passes via Guyon's canal? And which nerve passes via carpal tunnel? Which nerve passes via carpal tunnel? Median nerve. Important. ठीक है, याद रखना. No issues with this. Above the flexor retinaculum, ulnar nerve. Beneath the flexor retinaculum, median nerve. Okay. Important is this. Then if I talk about carpal tunnel syndrome first, okay? So if I talk about the carpal tunnel syndrome, here you can see the carpal tunnel which is beneath the flexor retinaculum. This is the flexor retinaculum. Beneath it you can see multiple structures are passing from the carpal tunnel. The nerve which passes is known as the nerve passes is known as the. Then there are 8 tendons in total. 8 tendons. 4 tendons of flexor digitorum superficialis. 4 tendons of flexor digitorum superficialis and 4 tendons of flexor digitorum profundus. 4 tendons of flexor digitorum profundus. कोई दिक्कत नहीं है इसमें. Please remember how many tendons pass? 4 tendons. 4 tendons of 8 tendons in total. 4 tendons of FDS and 4 tendons of FDP. And which nerve? Medial nerve. So if there is compression of this carpal tunnel, it will lead to carpal tunnel syndrome. And which nerve would be compressed? Medial nerve is compressed. Okay, no issues with this. Anybody? ये होती है तुम्हारी carpal tunnel. Then if I talk about the Guyon's canal, if it is compressed, Guyon's canal is compressed, then there would be injury to the ulnar nerve. Partial claw hand would be seen. Then this one, flexor retinaculum is also present on the in the foot. Okay, flexor retinaculum is also present at the ankle. Okay, it is also present at the ankle. It extends from the tibia to the calcaneum. It extends from the tibia to the calcaneum. So it is on the medial side. Okay, it is on the medial side of the ankle or the medial side of the foot. It extends from the tibia to the calcaneum bone. Okay, and this is what is your flexor retinaculum. The space beneath the flexor retinaculum in foot is called as the tarsal. In foot, the space beneath the flexor retinaculum is called as the tarsal tunnel. And which nerve passes via the tarsal tunnel? Anybody? So the answer is tibial nerve. Okay, which nerve passes via tarsal tunnel? Tibial nerve. Which nerve passes via tarsal tunnel? Tibial nerve. अगर तुम्हारे पास tibial nerve option में नहीं है, you have anterior tibial nerve and posterior tibial nerve. What would you mark? You will mark it as the posterior tibial nerve. You will mark it as the posterior tibial nerve. No issues with this, anybody? Please remember this. Okay. Along with that, what passes? Which artery? Tibial artery. Which artery passes? Tibial artery. And then tendons also pass. दो tendons pass होते हैं. First is flexor hallucis longus. First tendon is flexor hallucis longus, and second tendon is flexor digitorum longus. Second tendon is flexor digitorum longus. So दोनों longest tendon pass होते हैं. अंगूठे के लिए बोलते हैं hallucis, बाकी digits के लिए बोलते हैं digitorum. कोई दिक्कत नहीं है इसमें. Grade 2 it is hallucis. ठीक है. In hand it is pollicis. In toe it is hallucis. Then if I talk about this, important, very important, ठीक है, topographical relations of the humerus and the nerves. ठीक है. So if I talk about this, okay, if they mark arrow somewhere over here around the surgical neck of humerus, which nerve is related to the surgical neck of humerus? Which nerve is related to surgical neck of humerus? Axillary nerve. Which nerve is related to surgical neck of humerus? Which nerve is related to surgical neck of humerus? So in cases of fracture of surgical neck, which nerve is injured? Fracture of surgical neck, which nerve is injured? An axillary nerve is also called as the surgeon's nerve. Axillary nerve is also called as the root value of axillary nerve is C5, C6. Important. Along with that, around the surgical neck of humerus, two arteries lie in close relation. These are the दोनों भी होती है इसमें नहीं दिया. Anterior and the posterior circumflex humeral artery. Which arteries? Anterior and posterior circumflex humeral arteries. ठीक है. They lie in close relation to which landmark? Surgical neck of humerus. कोई दिक्कत नहीं है. Important दो arteries, anterior and posterior circumflex humeral artery. These are branches of the third part of the axillary artery. These are branches of the third part of the axillary artery. ठीक है. Axillary artery is divided into 3 parts by which muscle? Pectoralis minor. It is divided into 3 parts by the pectoralis minor muscle. Axillary artery is divided into 3 parts by the pectoralis minor muscle. कोई दिक्कत नहीं है इसमें. Next, if I talk about the mid shaft fracture, this is easy. If there is a mid shaft fracture of humerus, it causes damage to the which nerve? Radial nerve. Mid shaft fracture causes damage to the mid shaft fracture causes damage to the radial nerve, because radial nerve lies on the posterior aspect of the shaft of humerus. Okay, radial nerve lies on the posterior aspect of the shaft of humerus, and it passes via which groove? It is known as the spiral groove or the radial groove. Spiral groove or the, so in spiral or radial groove, which two structures pass? First is the radial nerve. First is the radial nerve. And second is the which artery? Profunda brachii artery. The other artery which passes from the spiral groove is the profunda brachii artery. कोई दिक्कत नहीं है इसमें, important. So if they ask you which artery is damaged in mid shaft fracture, answer is profunda brachii artery. And which nerve? Radial nerve. If I talk about the lower end of the humerus now, okay, so I hope all of you are quite aware. Usually there are two epicondyles on the lower end of humerus, the lateral and the medial epicondyle, and above that area it is called as the supracondylar area. And supracondylar fracture is usually common in children when they sit in a supracondylar fracture. Either they fall on the outstretched hand, So when a patient falls on an outstretched hand, और तो भी ला रहा हूँ, ठीक है? अभी time है तुम्हारे पास, नहीं है तो फिर. So if the patient falls on an outstretched hand, children में कौन सा bone fractured होगा? Children में it is the supracondylar fracture. Okay, in children में there will be a supracondylar fracture. In adults it will be a scaphoid fracture. In adults it will be a scaphoid fracture. In adults, most common fracture on outstretched hand is a scaphoid fracture. In elderly, the most common fracture on outstretched hand is usually the Colles fracture. In elderly, the fracture would be the Colles fracture for distal end of radius. कोई दिक्कत नहीं है इसमें, याद रख लो. Now supracondylar fracture में there is a potential damage to which nerve? Supracondylar fracture में there is more damage to the median nerve. Supracondylar fracture में there is more damage to the, if it is on the lateral side, ठीक है? So on lateral side, which nerve passes? Lateral supracondylar region. Lateral supracondylar region. Thank you so much. Lateral supracondylar region. Which nerve passes? Median nerve. Medial epicondylar or medial supracondylar region. So ये question आया था. They have marked at the medial epicondyle, and they have asked which nerve lies in close relation to this structure. So the structure was medial epicondyle. The structure was medial epicondyle, and the nerve which lies in close relation to medial epicondyle is ulnar nerve. The nerve which lies in close relation to the medial epicondyle is ulnar nerve. Okay, and which artery? Ulnar collateral artery. So medial epicondyle, which two structures? Nerve is ulnar nerve. Nerve is ulnar nerve. Artery is ulnar collateral artery. Artery is ulnar collateral artery. In posterior relation to medial epicondyle. In posterior relation to medial epicondyle. So in fracture of medial epicondyle, artery damage is ulnar collateral artery. Nerve damage is ulnar nerve. If I talk about lateral epicondylar fracture or supracondylar fracture of humerus, the potential damage is to the median nerve, and to which artery? Brachial artery. Which artery? Brachial artery. कोई दिक्कत नहीं है इसमें. Important. Now please tell me, the lateral epicondyle serves as a common origin for which muscles? Flexor or extensor? Lateral epicondyle is a common origin for extensor muscle. So lateral epicondyle is known as a common extensor origin. Lateral epicondyle is known as a common extensor origin. Lateral epicondyle is known as the common extensor origin, whereas medial epicondyle is known as the common flexor origin, because all the flexor muscles mainly originate from the medial epicondyle. So common flexor origin, common flexor origin, common flexor origin, common extensor origin, common extensor origin, lateral, common extensor origin, lateral epicondyle. Inflammation of the lateral epicondyle is known as lateral epicondylitis. Inflammation is known as lateral epicondylitis. Or which elbow? Very good. Which elbow? Tennis elbow. So lateral epicondylitis is whereas inflammation of the medial epicondyle is known as medial epicondylitis. And inflammation, medial epicondylitis is also known as which elbow? Very good. Saying it is golfer's elbow. Okay. It is known as the, so medial epicondylitis is, please tell me, olecranon bursitis is called as. All inflammation of the olecranon bursa when an individual sits like this for a longer duration. कैसे बैठते थे ऐसे? कहाँ बैठते थे? स्कूल में. और स्कूल में कैसे था? हमारे स्कूल में तो ये वुडन या फिर मेटल वाला था. So that can cause olecranon bursitis. So olecranon bursitis is also called as student's elbow. Olecranon bursitis is also called as student's elbow. कोई दिक्कत नहीं है. Lateral epicondylitis जल्दी. टेनिस elbow. क्या? सी टेनिस ऐसा खेला जाता है, ठीक है, यूज मतलब स्मैश लाइक दिस, ठीक है, टेनिस में. तो इट इज द लैटरल एपिकॉन्डाइल. गोल्फ ऐसे मारते हो तो इट इज द मीडियल एपिकॉन्डाइल, ठीक है. एंड स्टूडेंट्स एल्बो इज द olecranon bursitis. It is olecranon bursitis. Then if I talk about the lower limb, so here you can see the lower limb, the knee joint. Okay, these are the tibial condyles, and in relation to the lateral tibial condyle, we have the head of fibula. We have the head and neck of fibula. So the smaller bone is known as the fibula. So in relation to the lateral condyle of tibia or the neck of fibula, which nerve is present? It is the common peroneal nerve. Common peroneal nerve is a branch of jaldi. Very good. Common peroneal nerve is a terminal branch of. Common peroneal nerve is a terminal branch of. So sciatic nerve will divide into which two nerves? First is the common peroneal nerve and second is the tibial nerve. कोई issue नहीं है. So please remember, if they ask you the largest nerve of the lower limb, answer is sciatic nerve. Or largest nerve of whole body is also the sciatic nerve. Answer is largest nerve of whole body, sciatic nerve. It divides into common peroneal and the tibial nerve. And this common peroneal nerve lies in close relation to which two bony landmarks? First is the lateral condyle of tibia. And second is the neck of fibula. So in which fracture the common peroneal nerve is damaged? Fracture when you will get an impact from the lateral side. क्या बोलते हैं? गाड़ी आके ठोकेगी साइड से. Very good. So which fracture causes damage to common peroneal nerve? Which fracture causes damage to the common peroneal nerve? Bumper's fracture causes injury to the common peroneal nerve, and common peroneal nerve injury will cause foot drop. Common peroneal injury will cause foot drop. That means inability to dorsiflex the foot. ये क्यों मैं बता रहा हूँ dorsiflex the definitions? Because आजकल उनको आदत हो गई है directly drop ना बोलने की. They will mention the patient is unable to dorsiflex. तो वो याद होना चाहिए कि dorsiflex नहीं कर पा रहा. That means there is foot drop. हाँ, देख सकता है फुट ड्रॉप, देख सकता है. उसमें भी नर्व डैमेज हो सकती है. उसमें याद रखो वो शैंपेन बॉटल अपीयरेंस, चाकोट मैरी वाला, ठीक है. हाँ, फादर के अंदर इट इज द यूजुअली द फादर इज पोस्टीरियर हिप डिसलोकेशन. सो पोस्टीरियर जब जाओगे तो इट इज द स्कियाटिक नर्व. सो पोस्टीरियर हिप डिसलोकेशन में द मोस्ट कॉमन नर्व इंजर्ड इज द स्कियाटिक नर्व. पोस्टीरियर हिप डिसलोकेशन द मोस्ट कॉमन नर्व इंजर्ड इज द स्कियाटिक नर्व. कोई दिक्कत नहीं है, इंपॉर्टेंट. सो फुट ड्रॉप में कौन सा स्प्लिंट यूज करते हो, जल्दी बताओ. Which splint is used in foot drop? It is known as foot drop splint, also known as AFO, ankle foot orthosis, also known as ankle foot orthosis. ठीक है, वो splint याद रख लेना, important image है. No issues with this, anybody? So largest lower limb nerve is the sciatic nerve. If I talk about the lumbosacral plexus, ठीक है, so lumbar plexus is from L1 to L5. Lumbar plexus is from L1 to L5, and sacral plexus is from S1 to S4. So the lumbosacral plexus would be from L1 to S4. L1 to S4. Lumbosacral plexus. Important nerves याद रखनी है, सबके तो रूट वैल्यू नहीं पूछेंगे वो. First is the iliohypogastric nerve. Second is the ilioinguinal nerve. And this ilioinguinal nerve will innervate the muscles of scrotum. And muscles of scrotum have a specific name. Muscles of scrotum. These are known as the Dartos muscles. Okay, these are known as the Dartos muscles. So Dartos muscles of scrotum are innervated by the ilioinguinal nerve. Dartos muscles of scrotum are innervated by the ilioinguinal nerve. कोई दिक्कत नहीं है इसमें. Then we also have a lateral cutaneous nerve of thigh. And if the lateral cutaneous nerve of thigh is affected, there would be loss of sensation from the lateral aspect of thigh. And that is what is called as injury to lateral cutaneous nerve of thigh. It is called as meralgia paresthetica. So meralgia paresthetica is due to injury to which nerve? Lateral cutaneous nerve of thigh. Meralgia paresthetica is due to injury to which nerve? Lateral cutaneous nerve of thigh. Important, if they mark a structure, okay, if they mark the lateral thigh, loss of sensations बोल रहे, then definitely it is meralgia paresthetica, and due to damage to the lateral cutaneous nerve of thigh. ठीक है, रेडियल नर्व की वजह से चिरालजिया पैरास्थेटिका होता है. Then we also have a genitofemoral nerve arising from the lumbar plexus. Genitofemoral nerve के दो branches as we studied, genital branch and the femoral branch. Genital and the genitofemoral branch. Root value of genitofemoral nerve important है. Root value of genitofemoral nerve यहाँ पे देख लो, ये genitofemoral nerve है, कहाँ जा रही है? अरे कहाँ घुस रही हो? L1 and L2, L1 and L2. So genitofemoral nerve का nerve root is L1 and genitofemoral nerve का nerve root is L1 and L2. Please remember, ठीक है? No issues with this. And genitofemoral nerve is known to innervate which muscle? अभी बताओ वो तुम्हारी. Genitofemoral nerve is known to innervate the cremastric muscle. In genitofemoral nerve is known to innervate the cremastric muscle, and this cremastric muscle is known to elevate the testis, or it causes retraction of the scrotum or the retraction of the testis. ठीक है? So it is known as which reflex? Cremastric reflex. So cremastric reflex is innervated by which nerve? Cremastric reflex is carried by the genitofemoral nerve. Cremastric reflex is carried by the genitofemoral nerve. कोई दिक्कत नहीं है, याद रखो. Then we have a larger branch known as the femoral nerve, which will innervate the lower limb. Okay, femoral nerve. And we also have a obturator nerve. So femoral nerve will innervate which compartment of the thigh? Femoral nerve innervates which compartment? Very good. Femoral nerve innervates the anterior compartment of thigh. Femoral nerve innervates the anterior compartment of the thigh. That is your quadriceps femoris muscle. ठीक है? Quadriceps femoris muscle is innervated by the femoral nerve. ठीक है? Whereas obturator nerve will innervate the medial compartment of thigh. Obturator nerve will innervate the medial compartment of thigh. And in medial compartment of thigh, which muscles are there? Adductor muscles. Okay, adductor magnus, adductor longus, and adductor brevis muscles. So these three are innervated by the obturator nerve. कोई दिक्कत नहीं है इसमें. Important, please remember this. ठीक है? उसके अलावा the largest nerve which is having root value L1 to S3. Okay, sometimes they give it to S4 also. ठीक है? So L1 to S3. Sometimes some books also write it as S4. ठीक है? So depends, मतलब कभी होता है कभी नहीं होता from the S4. ठीक है? So L1 to S3 or L1 to S4 is the root value for largest nerve of the body, that is sciatic nerve. And we also have a pudendal nerve. Pudendal nerve innervate the genitalia. Pudendal nerve innervate the genitalia. Important. ठीक है? No issues with this. याद रख लो, important है. ठीक है? And as we discuss about the sciatic nerve also. Sorry, मैं L1 लिखा दूं. So it is L4 to S3. ठीक है? So it is L4 to S3. यहाँ से देख सकते हो. ठीक है? So it is L4 to S3. L4 to S3. कोई दिक्कत नहीं है. It is L4 to S3. Sciatic nerve largest nerve root होता है इसका. ठीक है? Root value सबसे ज्यादा होती है इसकी. MRI के अंदर वो prolapse के लिए पूछता है. They give you MRI picture and they ask you which is this disc prolapse. ठीक है? So disc prolapse is seen or vertebral prolapse is seen. So they have given in August. They have marked at the L5 vertebra and they have asked you which is this disc prolapse. So it was the L5 disc prolapse. ठीक है? So more common is usually the L4, L5 disc prolapse. So उसी पे question answer वो देख लेना. Groove is the space, मतलब जहां से डिप्रेशन होता है, जहां से कुछ पास कर सकता है. That is what is a groove. Sulcus भी बोल सकते हैं, groove भी बोल सकते हैं. Important groove अगर याद दिलाई है ये तुमने तो बता दो. Bicipital groove. Okay, the bicipital groove is also known as the intertubercular sulcus. Bicipital groove is also known as the intertubercular sulcus. And three important muscles insert at this bicipital groove between the tubercles of the humerus. Greater and lesser tubercle के बीच में कौन सा groove होता है? Bicipital groove, also known as the intertubercular sulcus. Which three important muscles? Lady between two majors. Lady between two majors. So on lateral side it is the pectoralis major. Lateral side it is the pectoralis major. Lateral side it is pectoralis major. Medial क्या हुआ? Medial side it is the teres major. Medial side it is the teres major. And in between, in the bicipital groove or the floor, in floor it is the latissimus dorsi. Floor it is the latissimus dorsi. So lady between two majors is inserted at the bicipital groove or the intertubercular sulcus. कोई दिक्कत नहीं है इसमें, याद रख लो. Next, if I talk about this one, ये क्या दिख रहा है? This is which triangle? Anybody? Very good. This is known as the Hasselbalch triangle. This is known as the Hasselbalch triangle or the inguinal triangle. Which hernia comes out from the Hasselbalch triangle? We discussed. Indirect or direct? From Hasselbalch triangle, this is the direct inguinal hernia. From Hasselbalch triangle, it is the direct inguinal hernia. Indirect inguinal hernia comes out from the deep and the superficial inguinal ring. Okay, indirect inguinal hernia passes from both the rings, deep as well as the superficial inguinal ring. It passes from both in deep as well as the superficial inguinal ring. But from the posterior, from the abdominal wall, directly from the Hasselbalch triangle, which hernia comes out? Direct inguinal hernia, which is more common in which age group? Elderly patients. Okay, no issues with this. So here, please remember the borders. Okay, medial it is the lateral border of rectus abdominis, and lateral border of rectus abdominis is called as abdominis is called as linea semilunaris. It is called as linea semilunaris. Lateral border of rectus abdominis is called as linea semilunaris. The hernia which arises from the linea semilunaris is known as Spigelian hernia. The hernia which arises from linea semilunaris is known as Spigelian hernia. Okay, so lateral border of rectus abdominis is known as linea semilunaris. Hernia arising is Spigelian hernia. Okay, it forms the medial border of the Hasselbalch triangle. Lateral border is formed by the inferior epigastric vessels. Lateral border is formed by the inferior epigastric vessels, whereas floor is formed by the inguinal ligament. Floor is formed by the inguinal ligament, or inferior wall is formed by the inguinal ligaments. कोई दिक्कत नहीं है इसमें, याद रखना. Please remember this. ठीक है? Sorry. Then if inferior epigastric vessels, they are used as a landmark to differentiate between which two hernias? Indirect and direct inguinal hernia. Medial is the direct inguinal hernia. Lateral to inferior epigastric vessel is the indirect inguinal hernia. And pubic tubercle is used as a landmark for inguinal and femoral hernia. Above and medial is the inguinal hernia. Above and medial is the inguinal hernia. Lateral and below is the femoral hernia. Then here you can see it is a spermatic cord. Okay, spermatic cord passes via. So I hope all of you are quite aware. Testes are developed in the abdomen, but during birth they transcend to the scrotal sac via the processus vaginalis. Okay, and this processus vaginalis traverses from the inguinal canal. Processus vaginalis traverses from the inguinal canal. Important. ठीक है? So inguinal canal से क्या क्या pass होता है? Spermatic cord mainly. It is the spermatic cord, right? And processus vaginalis. So spermatic cord के contents क्या होते हैं? They can be remembered as parting doesn't contribute to a good social life. ठीक है? So where P goes for the processus vaginalis. P goes for the processus vaginalis. Also it is remembered for pampiniform plexus. Also to be remembered for pampiniform plexus. Doesn't goes for deferens. That is the ductus deferens or vas deferens. Ductus deferens or vas deferens. Contribute goes for cremastric fascia and cremastric artery. Contribute goes for cremastric fascia and cremastric artery. 2 goes for testicular artery. 2 goes for the testicular artery. 2 goes for the testicular artery. A goes for the autonomic nerve. A goes for the autonomic nerve. G goes for the genital branch of genitofemoral nerve. So which branch of genitofemoral nerve passes via spermatic cord? Genital branch. Okay, which branch? Genital branch of genitofemoral nerve. Then S goes for the spermatic fascia. Okay, so social goes for the internal and external spermatic fascia. S goes for the spermatic fascia, and life goes for the lymphatics. Life goes for the lymphatics. क्यों बताया मैंने mnemonic क्यों दिया? Because this had come. Which of the following is not a part of the spermatic cord? ठीक है? So that is how you need to remember it. No issues with this, anybody? It passes via the inguinal canal. Inguinal canal has a deep inguinal ring and a superficial inguinal ring. Deep is oval, superficial is triangular. Which structures maintains the uterine axis? Anybody? So uterine axis, normal uterine axis कैसा होता है? The normal uterine axis is, normal uterus कैसी होती है? Tear shape तो होती है. Axis कैसा होता है uterus का? It is retro. Okay, it is anti-flexed and anti-verted. It is anti-flexed and anti. So normal uterine axis is anti-flexed and anti-verted. This is maintained by which ligaments? Very good. This is maintained by the round ligament. This is maintained by the round ligament. And second is the uterosacral ligament. Second are the utero. So uterine axis is anti-flexed and anti-verted. Uterine axis is anti-flexed and anti-flexed and anti-verted. It is maintained by which ligament? Round ligament and uterosacral ligament. Uterosacral ligament and round ligament maintains the normal axis of the uterus. But the most important support or the most important ligament of uterus is transverse cervical ligament, also known as the cardinal ligament, also known as the McEnroe's ligament. Please tell me which is the strongest ligament of body. The strongest ligament inside the body is the strongest ligament in the body, which maintains the posture of body while standing. It does not let the trunk fall back. It is known as the iliofemoral ligament. Strongest ligament of body is ilio. ये question आया था. Strongest ligament of body is ilio. Strongest ligament of body is ilio. Also known as the Bigelow's ligament. Also known as the Bigelow's. ये कैसा पूछ सकते हो? Strongest ligament of body is iliofemoral ligament. Also known as the strongest ligament of body is the iliofemoral ligament. Also known as the Bigelow's ligament. ठीक है, याद रख लेना. No issues with this. Anybody now? Then when you strike the upper medial thigh, testis would be elevated or the scrotal sacs would be elevated. This is known as which reflex? This is what is known as the cremasteric reflex. This is known as the cremasteric reflex, mediated by the cremasteric muscles. And cremasteric muscles are innervated by the genitofemoral nerve. They are innervated by the genitofemoral nerve. Root value was L1, L2. कोई दिक्कत नहीं है इसमें. Cremasteric reflex का उन्होंने एक बार root value पूछा था. That was L1, L2. Femoral, see, please remember, femoral branch would be the afferent branch. Okay, so yaad rakhna, if you strike the medial aspect of the thigh, the signals would be carried by the femoral branch. Okay, afferent ho gayi wo. And the action or the order would be sent by the genital branch. Okay, the order would be sent by the genital branch. So genital would be the efferent branch. So if they ask you efferent, it is genital branch. Afferent, it is femoral branch. कोई दिक्कत नहीं है इसमें. Then dilatation of the superior and inferior epigastric veins. Inferior and superior epigastric veins. They are usually present around the umbilicus. So dilatation of these veins will be called as क्या बोलते हैं? Varicose veins around umbilicus. Dilatation of, very good. It is known as the caput medusae. Caput medusae. So dilatation of the superior and inferior epigastric vein is known as. Dilatation of the superior and inferior epigastric veins is known as caput medusae. And this caput medusae, it is due to portal hypertension. It is due to portal hypertension, right? Important. And because usually at the superior and in the inferior epigastric veins, there is a portocaval anastomosis. There is a portocaval. So what do we mean by portocaval anastomosis? Connection between the portal circulation and the systemic circulation. That is what is called as the portocaval anastomosis. कोई दिक्कत नहीं है. So portocaval anastomosis is present in superior and inferior epigastric veins leading to caput medusae. It is also present in the anal canal, which causes internal or external hemorrhoids. It causes internal hemorrhoids. It causes internal hemorrhoids, and it is also present in the lower part of the esophagus. It also present in the lower part of the esophagus, which causes esophageal varices. Which causes esophageal varices. ठीक है? So in cases of portal hypertension, there would be dilatation of the portocaval anastomosis of 3 places around the umbilicus. It is known as caput medusae. In the anal canal, it would be lead to internal hemorrhoids, and in the esophagus lower part, it will cause esophageal varices. Drug of choice for esophageal varices, treatment and prophylaxis. दो अलग-अलग. Octreotide is the treatment. Prophylaxis, it is propanolol, and the best drug to treat is terlipressin. Best drug to treat is terlipressin. Yeah. Transpyloric plane. Now, I hope all of you are quite aware. The midclavicular lines divide the abdomen vertically, whereas horizontally the abdomen is divided into 9 quadrants by 2 planes. First is the transpyloric plane. Okay, which is also subcostal plane. It passes at which level? Anybody? It passes at the L1. Transpyloric plane passes at L1. Whereas the lower plane, which is known as the transtubercular plane, which passes from the tubercles of iliac crest. Okay, it is also known as दोनों iliac के बीच में पास हो रहा है ना. It is also called as trans-iliac plane. So transtubercular or trans-iliac plane is at which level? It is usually at the L4 level. Okay, transtubercular plane is at the L4 level. Transtubercular plane is at the L4 level. Left gonadal vein and suprarenal vein drains into. Very good. It drains into the left renal artery. Left renal vein. It drains into the left renal vein. Why it is important? Because as we know that the right gonadal vein, that is your right testicular or the ovarian vein, and the right suprarenal or the right adrenal vein will drain into the inferior vena cava, right? They directly drain into the inferior vena cava. But left-sided gonadal vein and left-sided suprarenal vein drains into the left renal vein. They drain into the left renal vein. कोई दिक्कत नहीं है इसमें. Important one-liners, all of these. Next, they give you these CTs and they ask you which is this mark structure. ठीक है? So the anterior most structure. So basal ganglia तो पता है, it is at the base of the brain. Okay, just behind the frontal lobe. So at behind the frontal lobe, the anterior most structure अगर वो mark करेंगे, it is the caudate. Anterior most structure if they mark, it is the caudate nucleus. And damage to caudate nucleus causes chorea. Damage to caudate nucleus causes chorea. Damage to caudate nucleus causes chorea. Then on the medial aspect of caudate nucleus, we have the lateral ventricles. On the medial aspect of the caudate nucleus, we have the lateral ventricles. Easy ऐसे भी याद रख सकते हो. Lateral aspect of the lateral ventricles is the caudate nucleus. Laterally to the lateral ventricles is the caudate nucleus. No issues with this. Then the pink color structure. Okay, it is known as the putamen. The pink one is known as the putamen. Okay, and putamen is the most common site for intracerebral hemorrhage. Very good. It is the most common site for intracerebral hemorrhage. Which artery is ruptured? Charcot's artery, also known as the lenticulostriate artery. Important. Okay. Next, in between the putamen and in between the caudate nucleus, there is a loop. Okay, this loop is known as the internal capsule. This loop is known as the internal capsule. So internal capsule is dense collection of the corticospinal tract. Internal capsule is dense collection of the corticospinal fibers, we will say. Okay, it is dense collection of the corticospinal fibers. Therefore, if there is any damage to the internal capsule, it will cause dense hemiplegia. Any damage to internal capsule will cause dense hemiplegia. Same side or contralateral side? Brain में cross innervation होता है, ये भूल गए ना? So it is a contralateral dense hemiplegia due to injury to internal capsule. So if the right internal capsule is damaged, left dense hemiplegia would be seen. No issues with this, yaad rakhna. Then behind the internal capsule, the red structure which is seen, it is known as the thalamus. Okay, it is known as the thalamus, and thalamus is the relay center or a resting center for all the corticothalamic tracts. Okay, it is a relay center for many of the corticothalamic tracts. कोई दिक्कत नहीं है. And if there is lesion at the thalamus, if there is any lesion at the thalamus, it causes a intractable pain in the body. It is called as a thalamic pain syndrome. Lesion in the thalamus causes an intractable pain in the body, and that is known as the thalamic pain syndrome. Or अगर और एक चीज होता है, if the right hand of this patient was cut, okay, if the right arm was amputated already, but then also the patient feels that my arm is aching, it is again due to injury at the thalamus. This is known as the phantom pain. This is known as the phantom pain phenomena. ठीक है, याद रख लेना. Then usually in middle of the third ventricle, you can see a structure known as the pineal gland. In middle of the third ventricle, you can see a structure known as the pineal gland. And pineal gland is known to secrete which hormone? Jaldi. Pineal gland is known to secrete melatonin. Pineal gland is known to secrete melatonin, and melatonin is known to maintain the circadian rhythm. Melatonin is known to maintain the melanin नहीं पूछा मैंने, melatonin पूछा. It is known to maintain the circadian rhythm. कब जागोगे, कब उठोगे. ठीक है, no issues with this, याद रखना. And the posterior most structure that you can see in off-white color, it is known as the hippocampus. And hippocampus is responsible for memory. It is responsible for memory. Short term or long term? It is responsible for short term or long term. Conversion of short term memory to long term memory. Okay, it is the function of hippocampus. Long term memory. Short term is the temporal lobe. ठीक है, short term is the temporal lobe. कोई दिक्कत नहीं है इसमें अभी. And hippocampus is also the site for which intracytoplasmic inclusion bodies? Rabies and Negri bodies. Then if I give you a CT, okay, CT at the level of thorax. So thorax का CT अगर मैं देता हूँ to you, so definitely you can see a thoracic vertebra, and that is the posterior side. Okay, important. And the rib is or the sternum is the anterior side. ये तो पहचान पाओगे. Next, at the thoracic level, the black structures that are seen, those are your black structure is lungs. Black structure is the black structure of the lungs. Okay, so now the anterior most structure that is seen, the circular anterior most structure is known as the which aorta? Ascending or descending? It is the ascending aorta. Anterior most is Anterior most is, whereas posterior most is descending aorta. Posterior most is, so there is an arc of aorta, na? So anterior most ascending aorta, posterior most descending aorta, and in between them you can see a bifurcation. This is the pulmonary artery. Bifurcation is seen at the pulmonary artery. If there is any embolus at this is called as the saddle embolus. This is called as the saddle embolus. ठीक है, याद रखना. No issues with this. कम से कम इतना पता होना चाहिए. No issues. And here a very small structure known as esophagus. So esophagus वो mark नहीं करते usually. Then normal abdominal CT की अगर मैं बात करूँ, definitely you can see a lumbar vertebra posteriorly, okay, and there would be structures which are seen. So I hope all of you are quite aware. Our right is the patient's left, our right is the patient's left, and our left is the patient's, our right is the, our left is the patient's right. कोई दिक्कत नहीं है, ये पता होना चाहिए CT में, ठीक है? So if you know this is the right side, then here you can find liver, okay? The very big structure where that you can find is the liver. Beneath the liver there would be a gallbladder. Beneath the liver there would be, so this one is the gallbladder, okay? Then just inside to the gallbladder we can have a elongated structure. This is what is called as your stomach. The elongated structure just inside to the gallbladder is known as the stomach, and behind the stomach, as we know, in the retroperitoneum we have the pancreas. In the retroperitoneum we have the pancreas. So stomach bed, I hope all of you are quite aware. Stomach bed is not formed by the spleen. It is formed by the pancreas. It is the head, body and the tail of pancreas. Okay? Important. No issues with this. Here you can see the, on extreme left, you can see a small structure known as spleen. On extreme left, you can see a small structure known as spleen. And then there would be right and left kidney. Which one would be superior? दिख कौन सी रही है? Which kidney is superior, right or left? Left kidney is superior. Which kidney is superior? Left kidney is superior, because on right side there is a liver. No issues with this. Or the posterior most structure that you can see over here, just over here, this is known as the inferior vena cava. This is known as the inferior vena cava. कोई दिक्कत नहीं है. Inferior vena cava का question एक बार पूछा गया. They have marked IVC and they have asked which structure is this. Again, one more CT that you can see over here. This is also a normal CT. Here you can see a vertebra, okay? And in this vertebra, which vertebra is this? Lumbar or thoracic? This is definitely the lumbar vertebra. Okay? Lumbar vertebra hota hai. Because you can see the right kidney, the left kidney, okay? Right kidney and the left kidney is seen, okay? Superior mesenteric vein and the superior mesenteric artery. And over here, just in close relation to the kidney is the inferior vena cava. And in close relation to the vertebra is the aorta, abdominal aorta. ये liver दिख रहा है थोड़ा बहुत impression, ठीक है? And here, as you can see, this gas or this bowel, okay, this gas which is seen, it is the bowel or the colon, okay? This gas which is seen, it is the bowel or the colon. याद रख लेना, ठीक है? No issues with this, anybody? So ये normal structures याद होना बहुत ज़्यादा important है यार, क्योंकि ऐसे ही वो पूछते हैं. तो मैं लगता होगा normal नहीं पूछते, but normally पूछते हैं. क्या? See, radiating pain, it can be due to kidneys also, it can be due to appendix also. Okay? So, because appendix and the umbilicus are innervated by the same dermatome, that is T10. Okay, it is the T10. Kidneys are also innervated almost by the same dermatome, that is T10. Therefore, there is referred pain always to the umbilicus. Okay? So, याद रखना, mainly it is appendix. You need to think first in terms of appendix. Kidney का और lumbar pain जो होता है, हमने देखा kidney और loin pain, it usually radiates to the genitals or the thigh. It radiates to the genitals or the thigh. Then over here you can see normal structures. ठीक है, normal तो सबको ही पता होंगे. So this is the X-ray of your wrist and the hand. Okay, so the larger bone on the larger bone usually is the radius. The smaller one is the ulna, and these are the radial and ulnar styloid process. These are the radial and ulnar styloid process. Okay. Then from lateral to medial, if you go, she looks too pretty, try to catch her. Okay. So the first bone on lateral side is the scaphoid bone. Next is the lunate bone. Next is the triquetrum bone. Next is the triquetrum bone. And the last one, medial most, is the pisiform. Next line, आगे की line की अगर मैं बात करूँ, she looks too pretty, try to catch her. So first is the trapezium. Second is the trapezoid. Next is the capitate, and last is the hamate bone. So medial most is hamate. There are how many metacarpals? 5 metacarpals are there. Okay, so these are the metacarpals मेटाकार्पोफेरेंजियल जॉइंट्स किस टाइप के जॉइंट है? कॉनकेव कॉन्वेक्स मेटाकार्पोफेरेंजियल जॉइंट्स, दीज आर कॉनकेव कॉन्वेक्स जॉइंट्स. क्या बोलते हैं इसको? और कॉनकेव कॉन्वेक्स जॉइंट्स, जल्दी से, मैंने बोला था ऊपर बताया था यार तुम्हें. कॉनकेव कॉन्वेक्स जॉइंट्स, कॉनकेव कॉन्वेक्स जॉइंट्स लिखा था ना मैंने? नहीं लिखा मैंने. कॉनकेव कॉन्वेक्स, कॉनकेव कॉन्वेक्स जॉइंट, concave convex joints, condyloid joint or the ellipsoid joint, condyloid joint or the ellipsoid joint, याद रख लो. But the first metacarpophalangeal joint is usually the saddle or the salar joint. कोई दिक्कत नहीं है इसमें, याद रख लो. Then if I talk about the phalanx, there are 3 phalanges, ठीक है? Proximal, middle and distal phalanges. I hope so all of you remember. And the proximal and distal interphalangeal joints are which type of joints? One directional movement, hinge joint. Okay, proximal and distal interphalangeal are hinge joint. No issues with this, anybody? These are the normal x-ray. Then next one, normal x-ray of the foot. ये classical आता है. So the bone that you can see, okay, so the lateral malleolus is formed by the fibula. Lateral malleolus is formed by the fibula, whereas medial malleolus is formed by the tibia. Medial malleolus is formed by the tibia. कोई दिक्कत नहीं है. Heel bone is known as the calcaneum. Heel bone is known as the calcaneum. Largest tarsal bone is the calcaneum. Okay, above the calcaneum we can see this bone. Above the calcaneum we can see this bone known as the talus. Above the calcaneum is the talus bone. In front of the calcaneum and talus we have a semicircular bone known as navicular. This was marked. Okay, in the last 2 exams this has been marked. Okay, so please remember, in front of the talus, the semicircular bone which is seen is known as the semicircular bone in front of the talus is known as the navicular. In lateral to the navicular is the cuboid bone. Lateral to the navicular is the cuboid, cube shaped hota hai, theek hai? In front of the cuboid bone, there would be, in front of cuboid and navicular, there are 3. In front of navicular and cuboid, there are 3 cuneiform. So usually if they ask you to mark 1, okay, so cuneiform bones lies in relation to the navicular bone especially. Okay, they lie in relation to the navicular bone and not the cuboid bone, Okay, no issues with this, yaad rakhna. So they articulate with the navicular bone. So kaun se hote hain cuneiform? Medial, intermediate, lateral. Medial, intermediate, lateral cuneiform bones. Again, 5 metatarsals would be present in the patient. Fracture of second and third metatarsal is called as. Fracture and third metatarsal neck is called as. Anybody? Fracture of second and neck metatarsal is called as. It is the fracture. Anybody in the online? Anybody online? Very good. It is known as the March fracture. Fracture of second and third metatarsal neck is. Fracture of second and third metatarsal neck is March fracture. March fracture is an example of, usually seen in military recruits or soldiers. It is an example of stress fracture. It is an example of stress fracture. And the investigation of choice for stress fracture is. Investigation of stress fracture is MRI. Investigation of stress fracture is MRI. बाकी सब चीजें X-ray करोगे तुम, ठीक है? Important. No issues with this. Next, if I talk about this one, these are the sesamoid bones can be present in the foot as well, ठीक है? Usually. Then the metatarsophalangeal joints are also the condylar or the ellipsoid joint, concave or convex. And again, proximal phalanges and the distal phalanges. In thumb, okay, in thumb or the great toe, we have only how many phalanges? 2 phalanges are there. That is proximal and distal phalanx. Okay, no issues with this, anybody? So this is the shaft of metatarsal. This is the base of metatarsal and the head of metatarsal. Base of metatarsal fracture is called as. Koi to bola. Base of metatarsal fracture is called as Jones fracture. Base of metatarsal fracture is called as. So base of fifth metatarsal fracture is called as. Fracture of base of fifth metatarsal is called as Jones. The fracture of base of fifth metatarsal is called as Jones. And tip ka agar hoga to pseudo Jones. Tip ka agar hoga to. No issues with this, anybody? Radial styloid process fracture is called as. Styroid process fracture is called as Schoffer's fracture. Radial styloid process fracture is Schoffer's fracture. Ulnar shaft fracture is called as. Ulnar shaft fracture is called as. All important fracture eponymous. Nightstick fracture. Ulnar shaft fracture is called as nightstick fracture. Okay, green stick fracture is commonly seen in children. Green stick fracture is commonly seen in only one cortex is damaged. Okay, no issues with this. This is the elbow ka X-ray, and this had come in August also, and uske baad bhi aaya ek baar. Okay, so normal elbow X-ray that you can see. So medially it is the medial epicondyle. Laterally it is the lateral epicondyle. in close relation they have asked you, ठीक है. So lateral epicondyle हमें पता भी चल गया था, but we were confused whether trochlea is lateral or capitulum is lateral, ठीक है. So please remember, lateral is the capitulum, lateral is the and medially is the ठीक है. No issues with this. Mnemonic क्या ही बना लो, MTCL बना लो, उससे याद रह जाएगा. तो medially it is the trochlea and laterally it is the capitulum. So it is confusing definitely. Okay, याद रखना. So lateral और अगर medial उन्होंने side भी दी है, then also you get confused. So please remember, MTCL is the mnemonic. Medial is the trochlea and lateral is the capitulum. कोई दिक्कत नहीं है. Then we have this radial head. Radial head articulates with the radial notch of the ulna. And it is covered by a ligament known as, this radio-ulnar joint is covered by a ligament known as annular ligament. It is covered by a ligament known as, why it is important? Because when you pull the child's forearm, there would be dislodgement of the radio-ulnar joint from the annular ligament. It will dislocate from the annular ligament, and this is what is called as nursemaid's elbow. This is not what is called as the nursemaid's elbow, also known as the pulled elbow, when the radio-ulnar joint dislocates from the annular ligament. ठीक है, कोई दिक्कत नहीं है, याद रख लो, ये important है. Okay, so बाकी तो important है. Above the medial epicondyle is the medial supracondylar ridge. Above the lateral epicondyle is the lateral supracondylar ridge. No issues with this. Now if I talk about एक important बात बता दो मुझे बस. As we talk about lateral epicondylitis, tennis elbow, medial epicondylitis, golfer's elbow, olecranon bursitis, student's elbow. Please tell me prepatellar bursitis is called as. In the knee, okay, in the knee, please remember, if there is inflammation of the prepatellar bursa, this prepatellar bursitis, anybody online? Very good. It is known as the housemaid's knee. Prepatellar bursitis is known as the because they sit on their knees. Okay. And second, infrapatellar bursitis is called as. Anybody? Very good. Clergyman's knee. Clergyman means a priest. Okay. So अगर वो कोई priest, father या फिर clergyman बोल रहे, then definitely it is the clergyman's knee. So infrapatellar bursitis, बोलो तो सही. Infrapatellar bursitis, क्या? Infrapatellar bursitis, clergyman's knee. Infrapatellar bursitis, clergyman's knee. And prepatellar bursitis, housemaid's knee. Housemaid's knee is and clergyman's knee is. कोई दिक्कत नहीं है इसमें. ये important चीजें अलग-अलग पूछते हैं. Next, you can see this quadrangular space. ठीक है, so quadrangular space होती है ये. तो ये important है. ऐसे ही landmarks को usually पूछेंगे. उनको कोई शौक नहीं है वन लाइनर ज्यादा पूछने का, because they know now you have, मतलब सब रट के बैठे हो तुम लोग. ठीक है, so quadrangular space से क्या क्या पास होता है? The axillary nerve and the posterior circumflex humeral artery. Which structures pass by the quadrangular space? Axillary nerve and the posterior circumflex humeral artery. No issues with this. So quadrangular space, it is formed superiorly by the teres minor, laterally by the surgical neck of the humerus, medially by the long head of triceps brachii, and inferiorly by the teres major. कोई दिक्कत नहीं है. This is the quadrangular space. Which structures pass? Axillary nerve and posterior circumflex humeral artery. कोई दिक्कत नहीं है. Please let me know. Long head of triceps brachii. It usually originates from. Supraglenoid and infraglenoid tubercle. It originates from the infraglenoid tubercle of the scapula. So infraglenoid tubercle से क्या originate होता है? Long head of triceps brachii. And supraglenoid tubercle से क्या originate होता है? Short है या long है? Long head, दोनों long. ठीक है? So it is the long head of biceps brachii. Short head arises from the coracoid process. ठीक है, याद रखना. So long head of biceps brachii arises from the supraglenoid tubercle and long head of triceps arises from the infraglenoid tubercle. कोई दिक्कत नहीं है इसमें. Important चीजें याद रख लो. Next, if I talk about this, what is this? Circle of Willis. What is the circle of Willis? And circle of Willis usually supplies the brain. Okay. So which artery does not form the circle of Willis or does not take place in the circle of Willis? Very good. It is the middle cerebral artery. So which artery is not a part of the circle of Willis? MCA, middle cerebral artery. Rather, which artery is a part? Internal carotid artery. Rather, which is the part? Internal carotid artery. So याद रखना circle of Willis. जल्दी. Anteriorly, it is formed by the two pairs of anterior cerebral artery. Anteriorly by two pairs of anteriorly by a pair of anterior cerebral artery. Posteriorly by a pair of posterior cerebral artery. Posteriorly by a pair of posterior cerebral artery. The artery communicating the anterior cerebral arteries is known as anterior communicating artery. The artery which communicates the posterior ones is known as the posterior communicating artery. And the middle, the major contribution would be from the internal carotid artery. Major contribution is from the internal carotid artery. The first branch of internal carotid artery is the ophthalmic artery. The first branch of the internal carotid artery is the ophthalmic artery. Okay, and if ophthalmic artery is occluded, there would be sudden monocular vision loss. There would be a sudden monocular vision loss in the patient. कोई दिक्कत नहीं है. So they can mark you and any of the vessels and they can ask you. ठीक है, तो ये तो समझ गए. एंटीरियर में दो पैर दिखते हैं, तो एंटीरियर सेरेब्रल आर्टरी, उन दोनों को कम्युनिकेट करने वाली एंटीरियर कम्युनिकेटिंग आर्टरी. सबसे बड़ी आर्टरी को मार्क करते तो इंटरनल कैरोटिड आर्टरी. फर्स्ट ब्रांच ऑफ इंटरनल कैरोटिड ऑफ्थैल्मिक आर्टरी. देन जो इंटरनल कैरोटिड को पोस्टीरियर सेरेब्रल को कम्युनिकेट करे, दैट इज योर पोस्टीरियर कम्युनिकेटिंग आर्टरी. एंड लास्टली आर्टरी व्हिच अराइजेस फ्रॉम द बेसिलर आर्टरी. ओके, जो आर्टरी के दो हिस्से होंगे फ्रॉम बेसिलर आर्टरी, दैट इज योर पोस्टीरियर सेरेब्रल आर्टरी. सो पोस्टीरियर सेरेब्रल आर्टरी are the branches of posterior cerebral artery are the branches of basilar artery, and basilar artery is formed by fusion of vertebral artery. फालतू में अलग होना ही क्यों था, ठीक है. So vertebral artery fuses to form the basilar artery, and basilar artery divides to form the posterior cerebral artery. No issues with this. Beneath the posterior cerebral you can see a superior cerebellar artery. Beneath the posterior cerebral you can see a superior cerebellar artery. ठीक है. एंड उसके नीचे जो सबसे बड़ी ब्रांच दिखेगी, इट इज द anterior inferior cerebellar artery. It is the anterior inferior cerebellar artery, AICA. And lastly you can see from vertebral artery there would be two branches arising, that is known as PICA, posterior inferior cerebellar artery. जल्दी से occlusion causes lateral medullary syndrome, Wallenberg syndrome, mainly by the vertebral artery and then by the pica. आप समझ गए क्यों? क्योंकि posterior inferior cerebral artery और pica arises from the vertebral artery. ठीक है, याद रखना. सो अगर नीचे से ऊपर जाए, सबसे पहली आर्टरी जो दिखेगी ब्रांच होती हुई, दैट इज द posterior inferior cerebellar artery, pica. उसके ऊपर जो दो ब्रांचेस जा रही है, दैट इज vertebral artery. वो फ्यूज होके एक मेन बनाएगी बेसिलर आर्टरी. बेसिलर फिर से डिवाइड होके दो बनाएगी पोस्टीरियर सेरेब्रल आर्टरी. उसके नीचे वाली बड़ी होगी तो सुपेरियर सेरेबेलर आर्टरी. ठीक है, उसके बाद जो कम्युनिकेट करेगी पोस्टीरियर कम्युनिकेटिंग आर्टरी, जो सबसे बड़ी होगी इंटरनल कैरोटिड आर्टरी. उसकी पहली ब्रांच जो निकलेगी ऑफ्थैल्मिक आर्टरी. उसके आगे जो सबसे दो होगी एंटीरियर सेरेब्रल आर्टरी, उन दोनों को कम्युनिकेट करने वाली एंटीरियर कम्युनिकेटिंग आर्टरी. एंड दिस वन ओवर हियर इज एंटीरियर कैरोटिड आर्टरी. अब कोई दिक्कत नहीं है. एंड जो भी बाकी बेसिलर से छोटी मोटी ब्रांचेस अराइज हो रही है, ऑल ऑफ दोस आर पोंटाइन आर्टरीज. नेक्स्ट, दिस इज द स्ट्रक्चर. ये इंपॉर्टेंट लैंडमार्क्स बता रहा हूँ, बाकी तुम्हें रटा हुआ है. ये इंपॉर्टेंट ऐसे ही वो मार्क करके कहीं भी दे देते हैं. बताओ ये क्या है, बताओ ये किससे इनर्वेट होता है. सो दे आर यूज्ड टू दिस. ठीक है, सो आई होप ऑल ऑफ यू आर क्वाइट अवेयर. यूजुअली द कॉमन कैरोटिड आर्टरी bifurcates into the internal carotid artery and the external carotid artery. At the bifurcation there is a dilatation which is seen, and that is what is called as the carotid body and the carotid sinus. Okay, जो orange color में दिख रहा है, this is the okay, the orange color one, arrow of orange color. ठीक है, this is the carotid sinus, this is the carotid sinus, this is the carotid sinus, and the blue arrow is the carotid अलग कलर तो यूज करते कम. ठीक है, अपन कलर मार्क कर देते उसको. ठीक है, we will do it blue. No issues with this. So the blue color structure is, आप तो बोलो, the blue color structure is whereas the orange one is the carotid sinus. So carotid body works as the chemoreceptors. Carotid body are Carotid body are, so they will detect the increase or decrease in the oxygen saturation levels. ठीक है? So these work as the chemoreceptors. ठीक है? और carotid sinus works as baroreceptors. That means they will increase they will detect the increase or decrease in the pressure. They will detect the increase or decrease in the mean arterial pressure. कोई दिक्कत नहीं है इसमें. So chemoreceptors are CBC याद रख लो भाई. CBC is a mnemonic. Okay, chemoreceptors are carotid body are chemoreceptors are, and carotid sinus is baroreceptor. Carotid sinus is baroreceptor. No issues with this. At bifurcation we have the carotid body. And at proximal internal carotid we have the carotid sinus. At the proximal IC we have the carotid sinus. ठीक है? Sinus है वो, artery नहीं है. ठीक है, याद रखना. And both of these are innervated by glossopharyngeal nerve, and some of them by the vagus nerve. So main innervation is by the, तो ये question आया था, carotid sinus and carotid body are mainly innervated by glossopharyngeal nerve. Carotid sinus and carotid body are mainly innervated by glossopharyngeal nerve, whereas carotid sinus, some part of the carotid sinus and carotid body is also innervated by vagus nerve. कोई दिक्कत नहीं है इसमें, अभी याद रखना. This one is what? This one is the triangle of auscultation. This one is the triangle of auscultation. So you can keep your stethoscope over here and you can hear the lung sounds much better. This is known as the triangle of auscultation. So medial border of triangle of auscultation is formed by the trapezius muscle. Medial border by the ठीक है. Inferior border by the inferior border by the and lateral border by the scapula. Okay, lateral border by the medial border of scapula. Lateral border by the medial border of scapula. This is known as triangle of auscultation. कोई दिक्कत नहीं है, ठीक है. So बाकी तो auscultation points तो याद ही होंगे for heart. Second intercostal space, right side, aortic area. Okay, aortic valve. Second intercostal space, left side, pulmonic valve or the pulmonic area. Third intercostal space, left side, left sternal border, Erb's point. Okay, third intercostal space, left sternal area, Erb's point. Fourth intercostal space, left midclavicular line, tricuspid valve. Okay, it is a tricuspid valve. And the fifth intercostal space, midclavicular line or the mid-axillary line, it is the apex beat of the mitral area. Heart is formed on which day? Embryology. Heart, ये question आया था. Heart is formed on 18 to 19 day. Heart formation begins on, and first heartbeat is on the 22nd day. Better answer है, ठीक है. First heartbeat on the 22nd day. कोई दिक्कत नहीं है इसमें, याद रख लो. Important is this. Then please tell me, apex of the heart is formed by which chamber? Left ventricle. Apex of the heart is formed by. Therefore, in cases of left ventricular hypertrophy or in cases of hypertrophic HOCM, hypertrophic obstructive cardiomyopathy, there would be a heaving apex. ठीक है, बहुत ज्यादा apex होगा. No issues with this. याद रखना, important है. Base is formed by the right and the left atrium. Base is formed by the right and the left atrium. वो right border है, वो आगे discuss करते हैं. question जल्दी से. Fundus या body of stomach. ये अगर मैं stomach की बात करूं, जल्दी से करते हैं, खत्म. Fundus या body में which cells are present? Zymogen or so zymogen cells are also called as, and they secrete pepsinogen. And pepsinogen is converted to pepsine. Pepsine is a proteolytic enzyme. This pepsinogen to pepsine conversion is done by HCl. So pepsinogen is secreted by which cells? Zymogen or chief cells located in the fundus or the body. Next are the oxyntic or the parietal cells, also called as the oxyntic cells. Parietal also called as the located in the fundus or the body, and they secrete HCl and intrinsic factor of Castle. They secrete HCl and intrinsic factor of Castle. कोई दिक्कत नहीं है. HCl only gives the acidic medium, and therefore the stomach pH is 1 to 2. An intrinsic factor of Castle is required for absorption of vitamin B12 from the terminal ileum. Mucous neck cells will secrete mucin. Mucous neck cells will secrete mucin to keep the secretions thoda bahut alkaline, okay, or to protect the mucosa. It is usually the mucin is secreted to protect the stomach mucosa from the HCl. Then from the pyloric antrum or the pyloric canal, we have the G cells. Pyloric antrum or pyloric canal, we have the G cells, and these G cells are known to secrete gastrin. G cells are known to secrete gastrin, and gastrin will stimulate the production of HCl. It will stimulate the parietal cells to secrete HCl. Stomach का blood supply एक दो बार पूछा जा चुका है, important है. Okay, so this one, the longer border that you can see, it is known as the greater curvature. The shorter border is known as the lesser curvature. Shorter border is known as the lesser curvature. Important if they ask you, the greater curvature is supplied by, it is the left and right gastroepiploic artery. Greater curvature is supplied by left and right gastroepiploic artery. Greater curvature is supplied by left and right gastroepiploic artery. How to remember? बहुत बड़ा नाम है, बड़ा curvature, ठीक है? Whereas lesser curvature is supplied by the left gastric artery and right gastric artery. Lesser curvature छोटा नाम, छोटा curvature, left gastric and right gastric artery. कोई दिक्कत नहीं है, important है, ठीक है? So this splenic artery is the one which supplies the spleen, ठीक है? Short gastric arteries will supply the fundus. Short gastric arteries will supply the and gastroduodenal artery is the most common artery to bleed in duodenal ulcer. It is the most common artery to bleed in duodenal ulcer. Which is the most common artery to bleed in gastric ulcer? Left gastric artery. The most common artery to bleed in gastric ulcer is left gastric artery. The artery to bleed in esophageal varices is again the left gastric artery. The artery to bleed in esophageal varices is left gastric artery, because the left gastric artery supplies to the lower part of the esophagus. कोई दिक्कत नहीं है इसमें अभी, important. Then pacemaker cells of stomach, ये सबको आता है. It is known as the interstitial cells of Cajal. Pacemaker cells of stomach are called as interstitial cells of. So interstitial cells of Cajal bolo, interstitial cells of Cajal bolo. Pacemaker cells of stomach are interstitial cells of Cajal. And the tumor which arises from this cell is known as GIST. Tumor arising from interstitial cells of Cajal is known as GIST. Gastrointestinal stromal tumor. Lymphatic drainage of stomach. Usually they drain in which lymph nodes? Lymphatic drainage of stomach is in the celiac group of lymph nodes. Okay, lymphatic drainage of stomach is in the celiac lymph nodes. No issues with this. याद रखना, पैरा एओर्टिक या प्री एओर्टिक लिम्फ नोड्स में कौन ड्रेन करता है? गोनाड्स, टेस्टिस, ठीक है, याद रख लेना. वो ऊपर आता है तो भी मतलब याद नहीं रहता, तो टेस्टिस यूजुअली द गोनाड्स ड्रेन इनटू द पैरा एंड द प्री एओर्टिक लिम्फ नोड्स. याद रखना. Which layer is absent in esophagus? Your classical question. Okay, the outermost layer is absent in esophagus, known as serosa. Which layer is absent in esophagus? And for all the other structures of GIT, the outermost structure present, it is not called as, outermost layer is not called as serosa. Rather, it is called as adventitia. It is called as the adventitia. कोई दिक्कत नहीं है, important. So I hope all of you are quite aware. In GIT, we have the inner circular muscles and the outer longitudinal muscles. Inner circular and outer longitudinal. ये भी question आया हुआ है, ठीक है, important है. Which nerve plexus is absent in achalasia cardia? So in achalasia cardia, as we know, the nerve plexus is absent. Therefore, it is usually in the constant spasm. ठीक है. So which nerve plexus is absent? The myonteric nerve plexus. Which nerve plexus? Myonteric plexus of, नाम क्या है? Panteric plexus of Orbach. Myonteric plexus of. So which plexus is absent in achalasia cardia? Myonteric plexus of Orbach. This is located in the which layer? This is located in the muscularis layer. Myo means muscle. So myonteric plexus of Orbach is located in the whereas the submucosal plexus is called as Meissner's plexus. Submucosal plexus is called as Meissner's plexus. कोई दिक्कत नहीं है इसमें, याद रख लो. Paneth cells are located within इंपॉर्टेंट क्वेश्चन है, वन लाइनर है। ऐसे ही वो अलग अलग नाम पूछते हैं, पेक सेल्स, पैनेट सेल्स, एनाटॉमी से यही खेलते हैं। पैनेट सेल्स आर लोकेटेड विद इन intestinal glands. Very good. Panel cells are located within. Panel cells are located within. Panel cells are located within. And these panel cells are known to secrete an enzyme known as. Panel cells are known to secrete lysozyme. Panel cells are known to secrete, which will destroy the microorganisms. Okay, so panel cells are known to secrete lysozyme, and they are present in the intestinal glands. Circular folds in the intestinal mucosa are called as. These can also be called as plicae circularis or also known as valvulae coniventes. They are also called as valvulae. So circular folds of plicae circularis in the intestine are also called as valvulae. They are also known as valvulae. More predominant in the jejunum. More predominant in the jejunum. And what is the characteristic of colon? Hostration. What is the characteristic of colon? Hostration. Whereas a mucosa-associated lymphoid tissue is present in which part of colon? Ileum. And those are known as? Very good. Ileum में the mucosa-associated lymphoid tissue is known as Peyer's patches. Ileum में the mucosa-associated lymphoid tissue is known as Peyer's patches. No issues with this? याद रख लो. Total number of sphincters near the ampulla of Vater. So I hope all of you are quite aware. Ampulla of Vater is the space where the main pancreatic duct and the common biliary duct open via single pathway. In the which part of duodenum? Anybody? Ampulla of Vater is in which part of duodenum? All those online. It is the second part of the duodenum. That is the D2. Okay, ampulla of Vater usually is in the second part of the duodenum. Ampulla of Vater में कितने sphincters होते हैं? नंबर पूछा था. कितने sphincters होते हैं? Total बस नंबर पूछा था उन्होंने. The total number of sphincters near the ampulla of Vater. Very good. 4. The total number of sphincters near the ampulla of Vater are 4. Okay. So there are 2 superior choledochal sphincter in the bile duct, common bile duct. 2 superior choledochal sphincter in the common bile duct. 2 superior choledochal sphincter in the common bile duct. So superior and inferior choledochal sphincter in the common bile duct. Then one sphincter is in the main pancreatic duct. One sphincter is in the main pancreatic duct. Okay, and the another sphincter is almost near the neck of the ampulla of Vater. The another sphincter is at the neck of the ampulla of Vater. कोई दिक्कत नहीं है, important है. Then most alkaline secretion in GIT. ये फिजियो का क्वेश्चन है, बट मैं उससे एनाटॉमी रिलेट कर रहा हूँ. कैसे देखो, मोस्ट अल्कलाइन सिक्रीशन ऑफ जीआईटी, व्हिच पार्ट? वेरी गुड, ड्यूडेनम. मोस्ट अल्कलाइन सिक्रीशन ऑफ जीआईटी इज फ्रॉम द most acidic from the stomach, obviously. So most alkaline is from the duodenum followed by pancreas. इसको almost 8 तक पहुंच जाता है pH. ठीक है. And these secretions are by the which glands of duodenum? Very good. These are known as the Brunner's glands. So which glands of duodenum secrete most alkaline secretion? Brunner's gland. No issues with this. Moving further. Spleen develops by. ये question था. Spleen development occurs from embryology से था. It develops from the dorsal mesogastrium. Spleen develops from the dorsal mesogastrium. No issues with this. It develops from the dorsal mesogastrium, and spleen does not form the stomach bed. It is not in posterior relation to the stomach. Parotid gland is innervated by the glossopharyngeal. No, parotid gland is innervated by the, whereas submandibular and sublingual were innervated by the facial nerve. Submandibular and sublingual by the facial nerve, but parotid by the glossopharyngeal nerve. So I love you as a friend किसके साथ होता है? Facial nerve के साथ. Facial nerve innervates the it passes via the parotid gland, but it does not innervate the parotid gland. Dangerous area of scalp किसको बोला जाता है? Dangerous area of scalp is the scalp के 5 layers होते हैं. S for skin, C for dense connective tissue, C for the dense connective tissue, A for aponeurosis layer, which is known as Galea aponeurotica. A is for Galea aponeurotica. L for loose areolar tissue, and P for the periosteum or the pericranium, जो भी बोलना चाहो. ठीक है. So dangerous area of scalp out of these all the layer is known as the, which contains the emissary veins. Which area contains the emissary veins? Loose areolar tissue. So which is the most dangerous area of scalp? Most dangerous area of scalp is because it contains the emissary veins. Because it contains the emissary veins. ठीक है? So there can be damage or there can be transmission of infection. So दोनों की वजह से it is the most dangerous area of scalp. कोई दिक्कत नहीं है, याद रखना. And damage to emissary veins causes which type of hemorrhage? Anybody? SDH, subdural hemorrhage. ये मत गलती करना. So anal canal यार, anal canal है ना, mostly हम we forget, but ये anal canal के anatomy से, topographic anatomy से question पूछ लेते हैं, ठीक है? So this is the rectum which then starts into the anal canal. So anal canal के तीन parts होते हैं, the mucosal, the transitional and the pigmented part, ठीक है? So the anterior most one is the mucosal part, which is made up from anal columns, and these are called as anal columns of. So these are known as anal columns of Morgagni. And usually these anal columns of Morgagni will also have the anal valves. They will also have these anal valves. Important, yaad rakhna. And the lower level of this anal columns is known as which line? Anybody? Very good. The lower level is known as the pectinate line or the dentate line. So pectinate or dentate line is the lower level of the columns of Morgagni. Okay, pectinate or dentate line is the lower level of the pectinate or dentate line is the lower level of the columns of Morgagni. कोई दिक्कत नहीं है इसमें. Next also you can see a line. This white line is known as white line of Hilton. This is known as white line of Hilton. After this white line of Hilton, usually the pigmented part of the anal canal starts. Okay, it looks like the normal skin. Okay, and after this white line of Hilton, it is known as the pigmented part, where there would be presence of sweat glands or the perianal hairs. Okay, before the white line of Hilton, there is no presence of any sweat glands or the perianal white glands or perianal hairs. Okay, important ये बताओ. Now there are three parts, as I told you. First is the mucosal part, second is the transitional part, and third is the pigmented part. Okay, so please tell me the epithelium of the mucosal part is epithelium of the mucosal part is columnar epithelium. Epithelium of the mucosal part is columnar epithelium, but epithelium of transitional and pigmented part is squamous. Epithelium of the transitional and pigmented part is squamous epithelium. But important difference क्या होगा? In transitional part there would be no sweat glands and no hairs, but in pigmented part there would be presence of hairs as well as the glands. ठीक है, no issues with this. कितना होता है ये? 15 mm, 8 mm. ठीक है, ऐसा याद रखना है तुम्हें. ठीक है, 15, 8. Okay, and the last one is the anal verge, and we also have, as we know, the internal one is known as the internal anal sphincter, whereas the external three parts are known as the external anal sphincters. ठीक है, and for anal incontinence, what is required? What is the most important structure for anal incontinence? Anybody? The most important structure for anal incontinence. Most important structure for anal continence bolo. Anal incontinence bolo. Most important structure for anal continence is the anorectal ring. It is known as the anorectal. So most important structure for anal continence is the anorectal. It is the anorectal ring. कोई दिक्कत नहीं है. Then what is this plexus known as? In the antero-inferior part of the nasal septum. This is known as the Kieselbach's plexus. It is located in which area? Little's area. And it is the most common cause of anterior or posterior epistaxis? It is the cause of anterior epistaxis. Kieselbach's plexus damage is the cause of anterior epistaxis. And Kieselbach's plexus is located in Little's area. ठीक है, antero-inferior nasal septum यहाँ पे. And if there is any damage to this, usually in children due to nose picking, so there would be epistaxis. Which four arteries form the Kieselbach's plexus? Jaldi. So first is the superior labial artery. And superior labial is a branch of facial artery. Second is the greater palatine artery. Okay. Third one is the sphenopalatine artery. And last one is the anterior ethmoidal artery. जिसको याद नहीं रहता वो निमोनिक बना लो अपना. ठीक है. Next, posterior ethmoidal. They most commonly ask you Which artery is not a part of Kieselbach's plexus? Answer is posterior ethmoidal artery. Which artery is not a part of Kieselbach's plexus? Posterior ethmoidal artery. Which artery is not a part of Kieselbach's plexus? Posterior ethmoidal artery. Rather, posterior ethmoidal artery will cause which type of epistaxis? It causes posterior ethmoidal artery, which will cause posterior ethmoidal artery will cause, and posterior epistaxis due to damage to which plexus? Posterior epistaxis due to damage to which plexus? Anybody? Posterior epistaxis due to damage to the Woodruff's plexus. Posterior epistaxis due to damage to the Woodruff's plexus. कोई दिक्कत नहीं है, याद रख लो, important, ठीक है? And if I say which is the most common artery to bleed in epistaxis, the answer is sphenopalatine artery. The most common artery to bleed is sphenopalatine artery, and therefore sphenopalatine artery is also called as artery of. It is also known as artery of epistaxis. So which is the artery of epistaxis? Which is the artery of epistaxis? Artery of epistaxis is the, so after all of that, direct pressure, chemical cauterization, okay, all of that, the first thing to ligate, the first artery to ligate is the sphenopalatine artery. कोई दिक्कत नहीं है इसमें, important. Then these are the neck triangles. नाम बता दो बस मुझे. So the triangle beneath the mentum is called as the submental triangle. Triangle beneath the mentum is called as the, okay, triangle beneath the mentum is called as the, and how many submental triangle do we have? One. How many submental triangle? How many submental triangle? It is common one. बाकी सब दो दो होंगे, ठीक है? Next, this is the anterior triangle of a neck, ठीक है? So anterior triangles of neck कितने होते हैं? 4. Anterior triangles of neck are 4. Posterior triangles of neck are 2. So first one is the submental triangle. Next one, the green colored one, is known as the. So the first one is the submental triangle. Second one is the submandibular digastric triangle. Second one is the. So the green one is the digastric triangle. The blue one that you can see, it is the. So superiorly क्या दिखेगा? Parotid triangle. Sorry, carotid triangle. Superiorly it is the carotid triangle, and beneath the carotid triangle, the yellow one is the muscular triangle. Yellow one is the muscular triangle. Muscular triangle क्यों बोलते हैं? Because only the strap muscles of the neck or the ribbon-like muscles of the neck pass via this muscular triangle. Carotid triangle, it is but obvious. What will pass? The carotid arteries will pass via the carotid triangle. ठीक है, important. Digastric triangle में the digastric lymph nodes important है, याद रखना, ठीक है, important, याद रख लो. And if I talk about the posterior triangle is usually formed, the superior posterior triangle is known as occipital triangle. Postero-superior triangle is, and postero-inferior triangle is, subclavian triangle. And subclavian triangle mein which part of brachial plexus is present? The trunks and the, the trunks and the divisions. Okay, which part of the brachial plexus is present in the subclavian triangle? The trunks and the divisions. कोई दिक्कत नहीं है इसमें. Please remember this. ठीक है, याद रखना, important है. The muscle to divide this triangle is usually the omohyoid muscle. Okay, the muscles to divide is the omohyoid muscle. Posterior triangles are divided by the inferior belly of omohyoid. Okay, posterior triangles are divided by the inferior belly of omohyoid. This one, inferior belly of omohyoid. Whereas the carotid and muscular are divided by the superior belly of omohyoid. Okay, carotid and muscular are divided by the superior belly of omohyoid. Whereas the submental and subclavian are divided, submental and the digastric are divided by anterior belly of digastric muscle. Submental and digastric are divided by anterior belly of digastric muscle. ठीक है, तो याद रखना, mandible के पीछे there is a digastric notch for insertion of this digastric muscle. ये important है, याद रखना. These type of neurons, the first type of neuron is what? Only one cell body and one axon. It is known as the first one is the second, two axons arising. This is known as the bipolar. Second one is the, and bipolar neuron, jaldi कहाँ पे थे? So bipolar neurons were seen in the olfactory neurons. Okay, bipolar neurons were seen in the olfactory neurons and also in the rods and cones. Then this type of neuron, which has the one cell body, one axon arises, but it gets divided into two. This is known as a pseudo-unipolar. This one is known as a pseudo-unipolar neuron. And the last one here you can see multiple axons arising. This is known as a multipolar neuron. Last one is known as a multipolar. अगर ऐसा कोई वो तो मैं area mark करके दिया, triangular area involving the bridge of the nose, the upper lip and adjacent cheek. This is called as the Very good. This is called as a dangerous area of face. This is called as a dangerous area of scalp was loose areolar tissue. Dangerous area of scalp was loose areolar tissue. But dangerous area of face is the pyramidal triangle, upper lip, nose, and adjacent cheek. Okay, why dangerous area of face? Because it drains into the deep facial vein. It drains into the deep facial vein. But उससे तो dangerous नहीं हो गया. But this deep facial vein communicates with the pterygoid plexus. It communicates with the pterygoid plexus. उससे भी dangerous नहीं हुआ. But this pterygoid plexus communicates with the cavernous sinus. This pterygoid plexus communicates with the cavernous sinus, and therefore any infection in this area, like the furuncle, okay, it can transmit via the deep facial vein to the pterygoid plexus to the cavernous sinus into the brain. Okay, and therefore it is a dangerous area. Okay, so why it is dangerous area of face? Because the infection can be directly transmitted to the cavernous sinus via which plexus? Pterygoid plexus. कोई दिक्कत नहीं है. Pterygoid canal की nerve का नाम बताओ जल्दी. Nerve of pterygoid के नाम? Vidian nerve. Vidian nervectomy, vasomotor rhinitis. मत भूलो, important question है ENT का. ठीक है. Vidian easy तो है, इतना easy है. Important ये एपोनिम्स है. जैसे फ्रैक्चर्स के एपोनिम्स से अलग अलग. ठीक है, फ्रैक्चर के एपोनिम्स हमने देख लिए कुछ जल्दी से. इंपॉर्टेंट. बॉक्सर्स मसल इज द muscle of marriage is the medial rectus. Muscle of honeymoon is the why it is called as muscle of honeymoon? Because it causes abduction of the hip joint. It causes abduction of the hip joint. Therefore, it is known as the honeymoon muscle. Which muscle is known as honeymoon muscle? It is known as honeymoon muscle, sartorius, and it is the longest muscle. Okay, it is also known as the longest muscle, also known as the Taylor's muscle. It is also known as the Taylor's muscle. ठीक है. Then swing muscle is the pronator quadratus. Swing muscle is the pronator quadratus. Climbing muscle is the latissimus dorsi. Climber's muscle is latissimus dorsi. Muscle of divorce is lateral rectus. Marriage की medial rectus, divorce की lateral rectus. ये important नहीं है, मैंने मजाक के लिए दिया है. But बाकी boxers is important. Honeymoon was asked. Climbers has also been asked. Taylor's has been asked. Okay, important is Taylor's muscle is the sartorius muscle. Anti-rape muscle is known as gracilis. Anti-rape muscle is known as because it causes now adduction of the hip joint. Okay, gracilis causes adduction of hip joint. It causes adduction of hip joint. So कैसे याद रखना है? Gracilis saves the grace of a lady. Okay, gracilis saves the grace of a lady, and therefore it is known as the anti-rape muscle. कोई दिक्कत नहीं है इसमें तो. Then red muscle is the posterior muscle. Important नहीं है. White muscle important. White muscle is the extraocular muscles. White muscles are the extraocular muscles क्योंकि blood supply थोड़ा कम होता है. ठीक है. As we saw, extraocular muscles कितने होते हैं total? 7. Okay. So all these 4 recti. How many recti do we have? 4 recti muscle. How many oblique? 2 oblique muscle. And for last one is the one levator palpebrae superioris, which is also called as eye opener muscle. Mouth opener is known as the lateral pterygoid muscle. Important. ठीक है. All these extraocular muscles originates from the annulus of Zen. They originate from the annulus of Zen. They are inserted behind the equator. The nerve the extraocular muscle which takes a turn is known as the extraocular muscle which takes a turn around the trochlea is known as the superior oblique. It is known as the superior oblique. Only muscle which takes a turn and inserts backwards is the superior oblique muscle. कोई दिक्कत नहीं है इसमें, याद रखना. All extraocular muscles are innervated by the oculomotor nerve except for LR6SO4. Spurt muscle is brachialis, छोड़ो. Shunt muscle is brachioradialis, छोड़ो. Ganser's muscle is flexor pollicis longus. Important is forgotten muscle is subscapularis. Key muscle is piriformis. Key muscle is okay, piriformis, because it divides the greater and the lesser sciatic notches properly. ठीक है. So important, pint and pin. Okay. So pint are the structures which process from the lesser sciatic notch, and pin are the structures which passes from the greater sciatic notch. ठीक है. So all of that are there. Then grinning muscle is risorius. Grin करते रहोगे तो रिसोरियस, जो अभी तुम मुझे कर रहे होगे, गालियां दे रहे होगे, ठीक है, दैट इज व्हाट इज ग्रेनिंग मसल इज रिसोरियस. स्माइलिंग मसल इज zygomaticus major. Smiling muscle is zygomaticus major. Laughing muscle is zygomaticus major. Laughing muscle is zygomaticus major. The muscle used for blowing or whistling. The muscle used for blowing or whistling. Buccinator and orbicularis oculi. Okay, sorry, orbicularis oris. Okay, so orbicularis oris and buccinator are known as orbicularis oris and buccinator are known as whistling muscle or blowing muscle. Whistling muscle or blowing muscle. Mastication or masseter muscle, temporalis muscle, lateral and medial pterygoid muscle. ठीक है, याद रखना. And they are innervated by the trigeminal nerve. Zygomaticus is the smiling or the laughter muscle. Buccinator or the orbicularis oculi are the muscles used for whistling or blowing. Grief muscle or sad muscle is the depressor anguli oris. मुंह किससे गिरता है? Depressor anguli oris. So it is the grief muscle. Locking, important. Locking muscle is, so locking of knee joint is caused by, and unlocking muscle is, very good, popliteus. Unlocking muscle of knee joint is, popliteus. ठीक है, कोई दिक्कत नहीं है इसमें. ये ventricles तुम्हारे, ये this is your, what is your CT looks like, ठीक है, sorry, MRI looks like. So यहाँ पे the anterior most, it is known as your lateral. The anterior most is the beneath lateral ventricle is the, and lateral ventricle and third ventricle are connected by the foramen of Monro. Lateral ventricle and third ventricle are connected by, foramen of. Then beneath the third ventricle, usually in the brain stem, okay, behind the brain stem we have the fourth ventricle. Behind the brain stem we have the triangular. Behind the brain stem we have the fourth ventricle, which is formed behind the brain stem, and the connection between the third ventricle and fourth ventricle is known as aqueduct of. So between lateral and third ventricle, between lateral and third ventricle, foramen of Monro. Between lateral and third ventricle, between third and fourth ventricle, aqueduct of Sylvius. ये भी क्वेश्चन वो पूछ सकते हैं, ठीक है, ऐसा ही कुछ मार्क करके बताओ. वेंट्रिकल्स का तो उन्होंने पूछा हुआ है, aqueduct पे भी आ सकता है, ठीक है. And this is the ependymoma, you can see, which arises from the ependymal cells which line the ventricles. Okay, and usually in the ventricles what is found? Black क्यों होता है? Which fluid? Cerebrospinal fluid, and it is produced by CSF. was produced, इतना easy था. First CSF, उसके बाद का पूछ रहा हूँ मैं. Cerebrospinal fluid is produced by choroid plexus. CSF is produced by choroid plexus. CSF is produced by choroid plexus. First CSF is formed by choroid plexus. Okay, it is formed by choroid plexus are the small blood vessels which are present in the ventricles. No issues with this, याद रखना, ठीक है. choroid plexus and absorbed by the arachnoid granulations or the arachnoid villi. ठीक है, no issues with this. यहाँ from fourth ventricle the CSF will go, बहुत जल्दी हो गई, देखो रुक जा. From fourth ventricle the CSF will go into the subarachnoid space via the foramen of Magendie, also known as foramen of Luschka and foramen of Magendie. So which two foramens are present in between fourth ventricle and subarachnoid space? Foramen of Luschka and foramen of between fourth ventricle and subarachnoid space. Foramen of Luschka and foramen of Magendie. कोई issue नहीं है यहाँ पे, आगे बढ़ते हैं. Then all muscles of tongue are innervated by. Movement of tongue is caused by hypoglossal. Now all movements of tongue are innervated by, except for the palatoglossus, which is innervated by cranial accessory nerve, Okay, so all muscles of tongue are innervated by hypoglossal nerve, except for palatoglossus, which is innervated by cranial. Yahi same funda for palate muscles also, right? All pharyngeal muscles are innervated by All pharyngeal muscles are innervated by the accessory nerve or the cranial part of accessory nerve, except for stylopharyngeus, which is innervated by glossopharyngeal nerve. ये next question आया था. Only abductor of vocal cord is. So only abductor of vocal cord is posterior cricoarytenoid. Only abductor of vocal cord is posterior cricoarytenoid. It is also called as safety muscle of larynx. It is also called as safety muscle of larynx. It is also called as safety muscle of, whereas safety muscle of tongue is safety muscle of tongue is safety muscle of tongue is genioglossus. It is known as genioglossus. Okay, it is attached to the genial tubercle of the mandible. इसलिए genioglossus. No issues with this. Anybody? याद रख लो. Then the adductor muscles की अगर मैं बात करूं जल्दी से, adductor muscles are thyroarytenoid, interarytenoid, lateral cricoarytenoid, and lastly cricothyroid. Main tensor of vocal cord is cricothyroid. The other one is vocalis. And all the muscles of larynx are innervated by, all intrinsic muscles of larynx are innervated by, recurrent laryngeal nerve. All intrinsic muscles of larynx are innervated by recurrent laryngeal nerve, except for cricothyroid, except for which is innervated by external branch of the superior laryngeal nerve, which is also known as external laryngeal nerve. So all intrinsic muscles of larynx are innervated by recurrent laryngeal nerve, except for cricothyroid, which is innervated by the external laryngeal nerve. कोई दिक्कत नहीं है, याद रखना. Okay, so most common nerve to unilateral अगर इंजरी होगा SLN होगी, bilateral होगा total thyroidectomy में it is RLN. Bilateral is usually RLN. ठीक है, no issues with this. बाकी NT में पढ़ लें. Number of branches of cervical part of internal carotid artery. Number of branches from the cervical part of internal carotid artery. जल्दी. Number of branches from cervical part of internal carotid artery. कितने? 1 2 3 4 5 कितने? Number of branches from cervical part of internal carotid artery. जल्दी online है, वो भी आंसर करो. और number of branches from cervical part of internal carotid artery. शाबाश. It is 0. Number of branches from cervical part. मैंने option मैंने तो बोला बस. Number of branches from cervical part of internal carotid artery is 0. This is how during epistaxis, when you need to ligate the external carotid artery, this is how you identify it. Because in neck, only which artery gives branches? External carotid artery. Internal carotid artery has no branches in the neck or the cervical part. External artery. अरे भाई हाँ ठीक है. External carotid artery के कितने branches होते हैं neck में? External carotid artery has how many branches? Very good. In the neck, external carotid artery has, in neck it has 5 branches. In neck it has 5 branches, and above it has 3 branches. Above it has 3 branches. So total कितने branch हो गए? 8 branches हो गए. And those are remembered as, so 5 branches are remembered as फोसला दिया होगा ना मैम ने, and next 3 branches are remembered as PSM. So at least ये PSM याद रखो. P for posterior occipital artery. P for posterior occipital artery. S for superficial temporal artery. S for superficial temporal artery. And M for maxillary artery. M for maxillary artery. So the 2 terminal branches of ECA are superficial temporal artery and maxillary artery. 2 terminal branches of ECA are superficial temporal artery and the maxillary artery. And superficial temporal artery is the most common artery to be involved in which type of vasculitis? Superficial temporal artery is the most common vessel involved in which type of vasculitis? Very good. Giant cell arteritis, also known as temporal arteritis. Shabash. ठीक है. Then next, right border of the heart is formed by. Sir is the mnemonic. Right border of heart is formed by. ये question था. Right border of heart is formed by Sir. S for superior vena cava. S for superior vena cava. I for inferior vena cava. I for inferior vena cava. And R for right atrium and right ventricle. R for right ventricle या right atrium? R for right atrium और right ventricle. जल्दी. Superior vena cava, inferior vena cava. अभी मैंने बोला था, क्या बोलते हैं? Base is formed by the right atrium. So right border would be formed by the right ventricle. क्लास में भी बता चुका हूँ यार मैं. ठीक है, right ventricle. ठीक है. Base is formed by the right atrium. ठीक है. Inferior border. Right border is by the right ventricle. कोई दिक्कत नहीं है इसमें, याद रखना. So importance, dominance in coronary circulation is left or right? Dominance in coronary circulation is left or right? It is mainly commonly right. It is mainly the right. So कैसा dominant circulation होता है in humans? Right dominant circulation. Okay, the coronary circulation in humans is right dominant circulation in 80% of the cases. ठीक है? And it is decided by, dominance would be decided from where the posterior interventricular artery arises. Okay, the posterior interventricular artery or the posterior descending artery. It arises from which main artery? That decides the dominance. Okay, so normally PIVA arises from the right coronary artery. Normally PIVA arises from the right coronary artery. Okay, some cases में from the left. Okay, so mainly the dominance is right coronary, sorry, right dominance in coronary circulation. Thymus lies in which part of mediastinum? Anterior, posterior, superior, inferior, middle. So thymus lies in the superior mediastinum. Thymus lies in the superior mediastinum. Thymus lies in the superior mediastinum. याद रखना. And esophagus lies in the posterior mediastinum. Esophagus lies in the ये important है. Bifurcation, ये question आया था. Bifurcation of trachea is at which level? C4. Bifurcation of trachea is at. So ये देखो, mostly commonly बोलते हैं कि living individuals it is the T6 level, whereas in cadaveric it is T4 level. ठीक है, T6 and T4 level. ठीक है, no issues with this. Next, if you can see this, what is this image suggest you of? ऐसी image देते हैं कुछ. क्या दिख रहा है? The neck is almost turned towards one side. This is called as wry neck. This is known as wry, also known as torticollis, also known as torticollis. It is due to spasm of the which muscle? Sternocleidomastoid muscle. So wry neck or torticollis is due to spasm of the sternocleidomastoid muscle. Wry neck or torticollis is due to palsy or spasm of the sternocleidomastoid muscle. कौन सी muscle? Sternocleidomastoid muscle. So which nerve injury should be there? Spinal accessory nerve. Which nerve injury? Spinal accessory nerve injury. No issues with this. And next one, यहाँ पे भी it is the spinal accessory nerve injury which causes this condition. Spinal accessory nerve injury causing this condition. What is this condition called as? So here you can see there is drooping of shoulder. There is drooping of shoulder. Okay. Also called as inability to shrug the shoulder. The patient will have inability to. It is due to palsy of which muscle? The shrugging of shoulder. Shrugging muscle is the trapezius. So inability to shrug the shoulder is trapezius palsy. Inability to shrug the shoulder is trapezius palsy. Okay, it is due to trapezius, and trapezius is innervated by the spinal accessory nerve. कोई दिक्कत नहीं है. आगे last बचा है. Largest sesamoid bone is patella, which forms the knee cap. And the largest sesamoid bone is formed in tendon of which muscle? As I told you, sesamoid bones are calcified or ossified in the tendon of a muscle. So largest sesamoid bone is formed in which muscle tendon? Is formed in the quadriceps femoris tendon. Okay. So patella is formed in which tendon? Patella is ossified in which tendon? So इधर pisiformis भी बता दो. Pisiformis is ossified in which tendon? Tendon of, अरे बता दो. Flexor carpi ulnaris. It ossifies in the flexor carpi ulnaris tendon. ठीक है, no issues with this. FCU tendon में होता है. For नहीं. Quadriceps femoris is different muscle. Hamstrings are different muscle. Anterior, posterior compartment के muscle है दोनों. So hamstring is the posterior compartment muscle. Quadriceps femoris is the anterior compartment muscle. ठीक है, याद रख लेना. ठीक है. And flabella is also a sesamoid bone जो present हो भी सकता है, नहीं भी हो सकता. That is usually formed in the tendon of the gastrocnemius. Spinal cord in adult and sat. Spinal cord in adults and sat. Which border of L1? Lower border of L1. Spinal cord in adults and sat. Lower border of. Okay, so spinal cord in adults and sat. Lower border of. Spinal cord in adults and sat. Lower border of L1 vertebra. Therefore, lumbar puncture in adults can be done at L3, L4. Lumbar puncture in adults can be done at L3, L4. In children, The spinal cord ends at, it usually ends at the upper border of L3. Okay, in children it ends at the upper border of L3, and therefore in children the lumbar puncture is performed at L4, L5. In children it is performed at L4, L5. कोई दिक्कत नहीं है. Usually the correction of nerves which arises from the conus medullaris, from the terminal part of your spinal cord, it is known as cauda equina. Okay, from conus medullaris the nerves which arises are known as cauda equina. ठीक है. Largest commissural fibers in brain. जल्दी ये one liner से सब. Largest commissural fibers in brain. Largest commissural fibers in brain. C-shaped fibers which connects the two cerebral hemispheres. Corpus callosum. The largest commissural fibers in brain are. The largest commissural fibers in brain are, and the commissural fibers which connects the Wernicke's area to the Broca's area known as arcuate fasciculus. Shabash. Which epithelium is seen in the ducts, thyroid follicles, and germinal layer or germinal cells? Very good. This is important. याद रखना यही exception होता है, यही भूल जाते हो. So they tend to ask you about cuboidal epithelium. Which epithelium lines the ducts? So which epithelium is found in common bile duct? Cuboidal epithelium. Which epithelium lines the ducts? Cuboidal epithelium. Which epithelium lines the thyroid follicles? Which epithelium lines the thyroid follicles? And which epithelium is found in the germinal layers, that is in the gonads? Your cuboidal epithelium. कोई दिक्कत नहीं है. Columnar cells usually in the columnar epithelium in the intestine वगैरह, wherever there is secretion. Squamous wherever there is protection. Flat cells. ठीक है. Hazel's corpuscles are seen in. Shabash. Hazel's corpuscles are seen in. Hazel's corpuscles are seen in thymus. Malphizian corpuscles are seen in. Malphizian corpuscles and ducts of Bellini. Kidney. Malphizian corpuscles in. Malphizian corpuscles in. Malphizian corpuscles in. Hazel's corpuscles in. Thymus में. Hazel's. Kidneys में. And ducts of Bellini also in. Kidney. Ducts of Bellini in. Kidney. Okay. Parafollicular C cells in. यार एक important बात बस बता दूं, important है यार वो. So as I told you, कहाँ गई वो बात, कहाँ गया वो टेबल. So first pharyngeal pouch, it derives into eustachian tube, middle ear, and the mastoid antrum. Second pharyngeal pouch develops into tonsils. Okay, second pharyngeal pouch develops into tonsils. Third pharyngeal pouch develops into thymus and inferior parathyroid gland. उल्टा है, inferior पैरे आते हैं. Okay, so third pharyngeal pouch develops into thymus and inferior parathyroid gland. Fourth pharyngeal pouch develops into thyroid and fourth pharyngeal pouch develops into thyroid and superior parathyroid gland. And fifth pharyngeal pouch develops into ultimobranchial body. Fifth pharyngeal pouch develops into and this ultimobranchial body would lead to formation of parafollicular C cells, and parafollicular C cells are found in, these are found in thyroid. Parafollicular C cells are found in, and they are known to secrete. So parafollicular C cells secrete, and they are derived from, अगर मैं option दूं, they are derived from. Shabash. So the first choice should be neural crest cells. So parafollicular C cells are mainly derived from neural crest cells. Okay, single best answer would be neural crest cells. अगर वो option में नहीं है, then you will go for the ultimobranchial body or the fifth pharyngeal pouch, mainly from the neural crest cells. कोई दिक्कत नहीं है इसमें, तो इस वजह से वो बचा था. And the pharyngeal clefts, as I told you, pharyngeal clefts 2 to 6 usually obliterates and forms a cervical sinus. Patency causes branchial cyst. हाँ. Tympanic membrane is derived from which germ layer? Anybody? Very good. Tympanic membrane is derived from all three germ layers. Tympanic membrane is derived from all three germ layers: endoderm, ectoderm, and mesoderm. ठीक है, याद रखना. Most common site of foreign body in lung. Which lobe of lung? Anybody? Most common site of foreign body in lung. It is the most common site of foreign body. अब ये तो आना चाहिए यार. Online वाले. Right middle or right lower lobe? Right lower lobe. Most common site of foreign body would be right lower lobe, because the right-sided bronchus is straight and wider. Okay, the right-sided bronchus is straight and wider. Therefore, the foreign body site in lungs would be right lower lobe. Most common site for foreign body in lungs is the right lower lobe. ये question आ चुका है. Blood testis barrier is formed by which cells? Blood testis barrier. Blood testis, not CNS. Blood testis barrier is formed by the Sertoli cells. Blood testis barrier is formed by the which are also called as nerve cells, because it give nutrition to the spermatozoa. Okay. Whereas the interstitial cells of Leydig, they are known to secrete. Interstitial cells of Leydig are known to secrete testosterone, whereas granulosa cells of ovary are known to secrete estrogen. Important. These are therefore called as sex cord cells. These are known as sex cord cells. याद रखना. Abductors of hip joint is mainly abductors of hip joint. तीन चीजें जल्दी. Abductor of hip joint. Sartorius का होता है थोड़ा काम, but it is not the main abductor. It is an accessory abductor. Main abductors of hip joint. Three important things I need to know. Gluteus medius and gluteus minimus. Okay, gluteus medius and gluteus medius and gluteus minimus and gluteus medius. These are the main abductors of hip joint, along with that tensor fascia lata. On all of these structures are innervated by which nerve? Superior gluteal nerve. All of these are innervated by the superior gluteal nerve. If they ask you the largest muscle, not longest, the largest muscle, it is gluteus maximus. Largest muscle is gluteus maximus, and it causes क्या करेगी gluteus maximus जब contract होगी? Gluteus maximus causes stability. तो stability नहीं देती इतनी. Stability iliofemoral ligament देती है. अरे extension और flexion of hip. Hip का करेगी ना कुछ ना कुछ. So it will cause extension of the hip. It causes extension of the hip. तभी तो contract होगी. Flexion of hip joint is caused by main flexors of hip joint. जल्दी से. Iliopsoas. Main flexors of hip joint are iliopsoas, iliacus, and the psoas major and psoas minor muscles. Posterior back muscles होती है. ठीक है. No issues with this. Gluteus maximus is innervated by the inferior gluteal nerve. नाम बड़ा है but artery inferior है. ठीक है. So gluteus maximus is innervated by the inferior gluteal nerve, whereas gluteus medius minimus and tensor fascia lata innervated by the superior gluteal nerve. And to assess this, we can do a which test? Anybody? To assess the abduction of the hip. Very good, bolo. It is the Trendelenburg test to assess the patency of superior gluteal nerve or the function of gluteus medius minimus and tensor fascia lata. Which test is done? Trendelenburg test. Which test is done? Trendelenburg test. कोई दिक्कत नहीं है. Unlocking of knee joint, as I told you already. Unlocking of knee joint is caused by popliteus muscle, whereas locking of the knee joint is caused by quadriceps femoris. Quadriceps femoris causes extension or flexion. Knee joint का flexion या extension? Quadriceps femoris causes extension of the knee joint. Quadriceps femoris causes extension. Contract जब होगी तब मसल काम कर रही है. ठीक है. Not जब relax होगी. So when does it contract? During extension of the knee joint. Flexion of knee joint is caused by popliteus muscle. Flexion of knee joint is caused by, इसीलिए तो lock होती है ना extend करने पे knee. That is what is called by quadriceps femoris. And flex करने पे unlock होती है. That is what is called by popliteus muscle. कोई दिक्कत नहीं है इनमें, याद रख लो. Then these are the planes that you need to remember. The plane which will divide the body. Okay, the plane which will divide the body in anterior and posterior is called as the the body is divided into anterior and posterior. It is known as the body divided in anterior and posterior. It is known as the body divided in anterior and posterior. Known as the body divided in right and left side. Known as the body divided in right and left half. Known as the sagittal plane. And body divided in upper and lower half. Known as the transverse plane. कोई दिक्कत नहीं है planes में. याद रखना. ज़्यादा time नहीं waste करना इन चीजों पे. Important is this dermatomes. ठीक है. What are these? These are dermatomes. ठीक है. So अगर face देखोगे तो okay, face is usually by the C2. Face is usually by the C2. So the nerve loop which is formed by the cervical nerve roots is known as ansa cervicalis. It is called as ansa cervicalis. याद रखना, ठीक है? So C2, okay, is usually the face. Okay, C2 is usually the face. C3 is usually the neck. C3 is the neck. C4 is the supraclavicular region. Okay, C4 is the supraclavicular region. ठीक है? Then C5 you can see it is the lateral arm. Okay, C5 is the lateral. C5 is the lateral arm. C6 is the lateral forearm. C6 is the lateral forearm. C7 is the C7 palm. Okay, तो कैसे third and fourth digits याद रख लो. Okay, C4 is the C7 is the third and C4 is the third. C7 is the third and fourth digit. Easy. 3 plus 4. 7. So C7 is the third and fourth digit. C8 is the medial palm. C8 is the medial palm. कोई दिक्कत नहीं है. मीडियल पाम और मीडियल हैंड भी, मतलब हैंड बोल सकते हो, मीडियल हैंड पूरा, ठीक है. थोरैक्स की अगर मैं बात करूं तो थोरैक्स के यूजुअली यार वो इतना तो तुम्हें डीप में नहीं पूछेंगे. इंपॉर्टेंट है अम्बलाइकल वाला याद रखना. सो अम्बलाइकल वुड बी एट द लेवल ऑफ T10. Umbilical is at the level of, so umbilical is which dermatome? Umbilical is which dermatome? Umbilical is which dermatome? And medial aspect of arm is first thoracic. Okay, medial aspect of arm is medial aspect. Green color का दिख रहा है ना? So medial aspect of arm is T1. Medial aspect of arm is T1. क्या है वहां पे? brachial plexus. खुद ही याद आ रहा है ना? T1 lower trunk याद रख लो, ठीक है. देन ग्लूट्स का पूछ सकते हैं, वो सेक्रल इंपॉर्टेंट है, ठीक है. सो S1. ओके, सो अगर सर्कल्स में जाएंगे इंपॉर्टेंट, तो प्लीज रिमेंबर द आउटरमोस्ट सर्कल इफ दे मार्क, देन इट इज यूजुअली L. आउटरमोस्ट सर्कल इट इज L. S1 का दिख रहा है. आउटरमोस्ट सर्कल इट इज L1. ओके, आउटरमोस्ट सर्कल इज L1 एंड L2. ओके, आउटरमोस्ट सर्कल इज यूजुअली L2. आउटरमोस्ट सर्कल इज L2. देन उसके अंदर वाला सर्कल इज S. अंदर वाला सर्कल इज S. It is S2. अंदर वाला सर्कल this is S2. Then inside is S3. Then inside is S4 and then inside is S5. तो याद हो गया. First outermost circle अगर मार्क करेंगे it is L2. Outermost circle is L2. अंदर वाला S2. अंदर वाला S2. अंदर वाला S3. अंदर वाला S3. अंदर वाला S4. अंदर वाला S5. ठीक है, याद हो गया. ग्लूट पूरे S2 to S5 होता है और सबसे बाहर वाला होता है L2 वाला, ठीक है. एंड दे मार्क, आई फील ये मार्क किया था शायद उन्होंने एंट्रोमीडियल एस्पेक्ट मार्क किया था उन्होंने. सो एंट्रोमीडियल एस्पेक्ट इज L4. एंट्रोमीडियल एस्पेक्ट इज L4. एंट्रोमीडियल एस्पेक्ट इज L4 याद रखना. whereas lateral aspect is anterolateral aspect is L5. Anterolateral aspect is anteromedial L4. Anteromedial एंट्रोलैटरल क्या हुआ? कुछ दिखने में कोई दिक्कत आ रही है? क्या बोल रहे हो? L4 मीडियल है, दिख रहा है ना कलर तो हमें. L4 इज मीडियल. करना है कोई टेस्ट वेस्ट FM, ठीक है, इंपॉर्टेंट. whereas lateral most part of the leg is usually S1. lateral most part of the leg is S1. okay, याद रखना. Please tell me the medial longitudinal arc and the lateral longitudinal arc, they will maintain the arc of the foot. Okay, that is cavus of the foot. But if this medial longitudinal arc is lost, then that will lead to pes planus. That is what is called as flat foot. Loss of medial longitudinal arc causes pes planus or flat foot. याद रख लेना. No issues with this. Important. Which is the most important ligament, most important tendon of the body? Very good. It is the tendo Achilles, known as the Achilles tendon. Okay, so if they ask you the most common sprained ligament, the most common sprained tendon is usually the Achilles tendon. Okay, सबसे ज़्यादा इंजरी किस टेंडन को होती है? The most commonly injured tendon is Achilles tendon or tendo Achilles. So usually from tendo Achilles to medial malleolus, उसके बीच में हम palpate करते हैं posterior tibial artery को. ठीक है, no issues with this. Tendo Achilles is important. ठीक है, याद रखना. Strongest ligament, as I told you, iliofemoral ligament और Bigelow's ligament. कोई दिक्कत नहीं है उसमें, और यहाँ पे अगर वो बोले most common ligament sprain in ankle और most common ligament sprain in whole body, टेंडन होगी वो, तो ligament चाहिए मुझे. most common, yes, it is the anterior talofibular ligament. It is the anterior talofibular ligament, also known as the anterior talofibular ligament, sometimes also referred to as the sling ligament. Okay, याद रख लें. ठीक है, no issues. The most common ligament sprain is usually the anterior talofibular ligament. Anterior talofibular ligament. कोई दिक्कत नहीं है. Most common soft tissue injury in knee. और तो पूछ रहा थोड़ा बहुत बता दो. Most common soft tissue injury in knee. Most common soft tissue injury in knee. All those online, jaldi. Very good. Which meniscus? Lateral or medial? Medial meniscus. Most common soft tissue injury in is medial meniscus. Most common soft tissue injury in is bucket handle tear होगा. And second most common soft tissue injury, ACL, anterior cruciate ligament. Second most common soft tissue injury, ACL, anterior cruciate ligament. So there are anterior and posterior cruciate ligament, which will give which stability to the knee? It will give antero-posterior stability to the knee. It gives antero-posterior stability to the knee. And lateral-medial stability to the knee is given by which collateral ligaments? Medially it is called as tibial collateral ligament. Laterally it is called as fibular collateral ligament. They will give a lateromedial or a mediolateral stability to the knee joint. Okay? If they ask you the most common ligament injury in knee, answer would be ACL. Most common soft tissue, medial meniscus. Most common ligament, ACL, because meniscus is not a ligament. ठीक है, कोई दिक्कत नहीं है, याद रखना. ACL injury is the most common ligament injury in the knee joint. कोई दिक्कत नहीं है, याद रखना. Investigation of choice for ligament injury or soft tissue injuries, MRI. Investigation of choice is a MRI. Investigation of choice is a क्या हो गया भाई? A child presents with cardiac. Sorry, अब देख लो. A child presents with cardiac defects, cleft lip, tetany. Which among the following mark structures is not here? Tetany is due to hypocalcemia. Tetany is due to so ये तो पता है ना. So tell me, a child presents with cardiac defects. तुम्हारा recall question है. Child presents with cardiac defect, cleft lip and hypocalcemia. Provisional diagnosis बनाओ. Very good. It is the DiGeorge syndrome. It is the DiGeorge syndrome. It is remembered by the mnemonic catch 22. C for हो गया last slide है. हाँ. So DiGeorge syndrome. C for cardiac abnormalities. Most common is cardiac anomalies. A for abnormal facies. T for thymus hypoplasia. So which axillary glands are not formed in cases of DiGeorge syndrome? So the third pharyngeal, which pharyngeal pouch is not formed in DiGeorge syndrome? And the third pharyngeal pouch derivatives are thymus and inferior parathyroid gland. Third pharyngeal pouch derivatives are thymus and the inferior parathyroid gland. So which structures are not formed in DiGeorge? Thymus and inferior parathyroid gland. So if inferior parathyroid glands are not formed, parathormone would be less, and therefore the patient will have hypocalcemia. समझ गए? Important बात. So याद रखना. Thymus, T for thymus hypoplasia. C for cleft lip or cleft palate. C for cleft lip or cleft palate. H for hypocalcemia, and 2 for microdeletion on chromosome number 22. So which pharyngeal pouch is not formed? Third pharyngeal pouch. So where are the pharyngeal pouches that you can see? So these are the pharyngeal arcs. Okay, and उसके पीछे pharyngeal pouches तुम्हारे. तो क्या होता है? क्या स्ट्रक्चर होगा? थर्ड pharyngeal pouch. ठीक है, इट इज द थर्ड pharyngeal pouch. ठीक है, याद रखना. ठीक है, ऐसी ही मार्किंग ये नीट पीजी में भी आई है, आईना सेट में भी आई है, तुम्हारे इसमें भी आ सकती है. अभी तक डायग्नोसिस ही आया है, बट आ सकती है. Which type of pivot joint is present at the arrow marked on the location below? So this is what? This is the pubic symphysis, and as we know, primary cartilaginous joint is called as synchondrosis, first sternoclavicular joint, or the epiphyseal diaphyseal joint. ठीक है, whereas secondary cartilaginous joint is called as symphysis. So this is the secondary cartilaginous joint. Very good. Which structure is palpated? तुझे दिख भी गया? Which structure is palpated in the given image? So as I told you, in between the Achilles tendon and medial malleolus, which artery is palpated? Posterior tibial artery. Please tell me at the navicular bone, which artery is palpated? Dorsalis pedis artery. At navicular bone, which artery is palpated? At navicular bone, which artery is palpated? Instead of navicular, they can also be palpated between the first and second metatarsal. Between the first and second metatarsal. Which artery can be palpated? Dorsalis pedis artery. Identify the marked bone in the given X-ray. Shabash. It is the talus. You can see this one, the largest tarsal bone, and the heel bone is known as the calcaneum. The largest tarsal bone and the heel bone is calcaneum. And above the calcaneum there is, and what can be seen over here in talus? Very good. It is avian, whitish appearance. Whitish agar dikhta hai, that means there is decreased blood supply or there is necrosis. Okay? There is decreased blood supply or necrosis. So in this you can see avian of the talus. Avian of talus is usually due to fracture of neck of talus, and that is what is called as the aviator's fracture. Fracture neck of talus is called as, and there would be avian of the body of talus. This is the third most common site. No issues with this, anybody? उसके आगे जो दिख रहा है ये semicircular bone. Talus के आगे this semicircular bone which is seen. So this is all talus, हाँ ठीक है. ये यहाँ पे तुम्हें ये दिख रहा है. So this semicircular bone is the navicular bone. उसके आगे cuneiform, okay, medial, intermediate and lateral cuneiform bones. An individual received covaxin but now complains of inability to abduct the arm. तुमने पहली बार इंजेक्शन दिया अपना, and patient is unable to abduct the arm. Loss of sensation over the vaccination site. It is due to injury to shabash. It is the axillary nerve. So individual received a covaxin, and covaxin या कोई भी vaccination कहाँ दिया जाता है? किस muscle पे? Deltoid muscle पे. Which muscle? Deltoid muscle. And here the patient is unable to abduct the arm, which is the function of deltoid muscle. 15 to 90 degree abduction, and there is also loss of sensation over this aspect of the arm. That is what is called as regimental badge sign. That is what is called as the regimental anesthesia or regimental badge sign. And regimental badge sign or palsy of deltoid and second teres minor or major? Teres minor muscle, which are innervated by the axillary nerve. So inability of teres minor, palsy of teres minor or deltoid along with regimental badge sign. It's classical injury to the axillary nerve of the surgeon's nerve. Root value C5 and C6. Long thoracic nerve. Bringing of scapula. Radial nerve. Wrist drop. Musculocutaneous nerve. Inability to flex the arm. Okay. A patient presented with history of vision loss. On investigation, an aneurysm was identified which was compressing the optic chiasma. Which of the following artery is most likely involved? So they are asking you which is the most common artery to have aneurysms actually. और ये हमने discuss कर लिया है. Berry aneurysms are formed in the anterior communicating artery and they rupture in the subarachnoid hemorrhage. Therefore, usually optic chiasma के ऊपर कौन सी होती है? Communicating artery, anterior communicating artery. And if there is any aneurysm in this anterior communicating artery, it will compress the optic chiasma. Okay, and that will cause bitemporal hemianopia. No issues with this. It can also be due to pituitary adenoma or a brain tumor known as craniopharyngioma. Brain tumor in child known as craniopharyngioma. These can cause bitemporal hemianopia. ठीक है? Thank you so much. Thank you guys. हो गया तुम्हारा एनाटॉमी का डर तू जिसको भी था?